All right, good evening, everyone. This work session of Osseo School Board is being conducted in person. This work session can be monitored electronically by streaming online from the district website, and an archive recording will also be available on the district website. The purpose of school board work sessions is to build trust and teamwork, to exchange information, and when applicable, to provide direction in order to facilitate efficient and effective decision-making at regular board meetings. The outcome of today's work session, our board members will receive an update on the 2021 fall back to school, receive information and provide direction on the development of the district's strategic roadmap, and review the board excellence and governance working package. To acknowledge attendance this evening, I'll ask the board members please state their names, and I'll start with you.
I'm Director Jackie Mosqueda-Jones.
Heather Douglas.
Director Thomas Brooks.
Director Tamara Grady.
Director Tanya Simons.
And I am Director Dawson Walton. I'm present. And now I will turn it over to Superintendent McIntyre to facilitate this evening's work session.
All right, thank you, Chair Dawson Walton, and thank you, board members. And tonight I will be providing you with an update on the information on our 2021-2022 back to school plan. On July 22nd, I put out our first back-to-school plan that stated students would attend school 5 days a week in person, and if online experiences are desired that or preferred, that parents could enroll their students in our 279 online school. And I also included information on a variety of other elements of our preparedness plan: vaccinations, confirmed cases, face coverings and masks, personal health hygiene, social distancing. We had information about meals, disinfecting and cleaning, and ventilation. We were one of the first districts to put our plan out there in July. There wasn't very many in the metro that had done that, to put out a plan for the fall that early in the summer. And that information at that time was based on the information we had available, based on the guidance from MDE, Minnesota Department of Health, and we also noted that things could change between now and the start of the school year based on further local, state, or federal direction. And at that time, we noticed that, everyone probably knows case rates were really pretty low at that time of the year in July. We communicated that questions or concerns after reviewing that information could be provided to us through We Listen, and we would carefully review those as we move through the summer. So I can say we've had a lot of engagement around that the last few weeks, and I'll come back to that in a minute. But I wanted to thank our students, our families, our caregivers, our community members for reaching out and sharing their perspectives. And including in those communications were some strong opinions and emotion on all sides, which we've worked hard to respect all those opinions, honestly, for the last about 18 months. So it's been another one of those challenging moments. So much has changed and continues to change since the update on July 22nd. There's been new information coming frequently, often on a daily basis. We have been really careful not to react too quickly, knowing additional information may continue to come. For example, we received new information today, and I was on a conference call with the commissioner today at 4 o'clock on a new COVID-19 testing program or plan from the State Department. So it's just an example how things continue to evolve. So tonight I'll provide the board with the most up-to-date information available. And before I start, I just want to be really clear because I think there's been some confusion. The one thing that we discussed many times last year, it still holds true, that in-person education and learning is critical, and that's what we are all focusing on, and really critical to our scholars' well-being and academic success. So tonight we're not talking about learning models. Just want to clarify that. Again, we're starting the year with students attending 5 days a week and in person, and if that online experience is preferred, we have that option available, and we are accepting enrollments. We continue to accept enrollments. We have space available at every grade level, so that is still available to anyone who wants it. Tonight we're going to be talking more about how do we provide the best mitigation strategies to ensure we stay in school and keep our scholars in school in person to the greatest extent we can. So some of the outcomes here have Kay helping me with the slides, so thank you, Kay. Just giving you more information as it relates to back-to-school plans, and then together with the board, with me establishing our decision model and determining the remaining logistics on a couple issues that we need to, I think, make some decisions about, and I'll have a recommendation for you on that. So I'm going to go into some information here that I think kind of gives you up-to-date pieces that we've been collecting over the past few days, especially because things have been evolving. But with that in mind, commitments remain the same. Our school district, I think you join me in this, we are committed to providing a safe and healthy learning environment for all of our students, staff, community members, and visitors. And in regards to COVID-19, this is done by mitigating the transmission potential in our schools and communities. Take a step back and look at where we were last year at this time, totally different space. We were directed by the State Department to come up with 3 different learning models: distance, hybrid, and in-person. I think we turned that into about 6 different learning models because we had different variations of those. But that's where we were at this time last year. We were really trying to create what those would look like as we were moving into August. And I might twitch a bit when I see this next one, but this was that framework about making decisions given the parameters we were given by the state to aid school districts in making those learning model decisions based on county case rate data. That did evolve as the year went along and became more of a localized case rate approach and operational data as we used our learning model dashboard in our elements that we designed that were most critical. This year, so last year was about learning models. This year is about mitigation, right? So I'll say it one more time. We're in school. And how do we keep students in school every day throughout the school year, with that being the goal? So that's the clear distinction between the last school year and this school year. You've all seen this framework. I've made some just subtle adjustments to this around more of a COVID-19 decision-making framework, but the key elements of this are still the same. We review case rate data or any other information available to us along with our key indicators. We do our consultation with a lot of our state agencies, MDE, MDH, MSPA, Hennepin County Public Health, our district and school leaders, our union leadership, and engaging with our family and caregivers in different ways to get their input. We bring that to you in the form of recommendations, and then we make together decide how are those choices going to be made. How do we take action? And then we communicate that, we implement it, and then we refine, and we make changes as we learn more, because there's just a constant ongoing amount of information coming through. So right now, where we're at, the information we have to kind of consider is a variety of things. CDC, MDH, including, I would say, Minnesota Department of Education, but it's been mainly MDH because they handle the health-related information. MSBA has provided some guidance on for school boards and how to work through some of these things. We do look at district and local data and conditions. It's been harder because we're in summer school or no school, so it's harder to glean some learnings from that. And then also learning from our district leadership, especially from the expertise that we have from last year and the learning we gained from going through all the different changes from last year. Also parent and caregiver feedback, and then lastly but not least, school board guidance, and that's why we're here tonight, for you to provide some guidance on where we go next. So some updated information for you just in the last couple days. This has been coming in even through this afternoon. This is a kind of a busy slide, but what the point I wanted to make here was through our consultation with Hennepin County, we are seeing the county is reporting a rapid increase in case growth of newly reported cases and average daily case rates. And the graphic on the right, and I think the TV kind of distorts it a bit, but you can see the portion of the county with some of the highest case rate growth are in our communities, some of our communities in the district. On the next slide, it gets at testing trends. So we've kind of been on a roller coaster with some of the testing data, and what this shows is we're seeing another uptick in testing, and the volumes are increasing. In really looking at that percent of positive tests, that is also increasing from what the county's reporting. Remember, 5% is that threshold for significant concern or transmission. And some details on age levels. So school-age children, what we've been provided with is from the 0 to 9 group, the percentage of positive test or percent of positive test is 3.25. 10 to 19 is 5.84. 20 to 29, that next group that's kind of beyond school age is 5.58, and then the 30 to 39 group is 4.96. So we are seeing what the county is sharing with us, some increased rates of percent of test positive. Another new perspective on this that's been kind of being put in place is more of a 7-day per 100,000 case rate, and they look at a number of categories. This is kind of a nationwide look, and then looking at states and counties. So going from no data to low, moderate, substantial, or high transmission rates. High is designated as more than 100 per 100,000. And if you go to the, you can see the colors here. So the color codes, I'm a colorblind guy, so I understand red is high and orange is substantial and yellow is moderate. You can see the majority of our state is in that orange or red category, so high or substantial, with a couple pockets of the state being in that yellow category in the moderate range. The University of Minnesota has been tracking this as well on the next slide, and our school district rate on this measure is 136. And you can see that graph on the bottom, putting us in the high transmission category for our school district, and this is available for all the school districts in the state on the University of Minnesota website. So that's just a new metric that's been kind of promoted by the CDC in the last few weeks. This next one is more familiar to you. So this is our 14-day case rate per 10,000. And you can just see through the trends here how we've now peaked into the low to mid-20s in our Brooklyn Center, Brooklyn Park communities, with Maple Grove, Plymouth, and our outstanding or other northwest suburbs that include Dayton and Corcoran and some of our other communities, all seeing what the county is calling rapid growth in the cities in our school district. And Brooklyn Center and Brooklyn Park are once again among the highest in the county, based on last week's data. Now, that used to come out every Tuesday. It comes out every Thursday now, so it's a different timing on the data. If you drill it down more, this is the last 7-day look at by age. And so the curve is now to the younger ages, primarily because, the vaccine's probably more being accessed more by people in the higher age groups. So we're now seeing that under 20 and 20 to 29 and 30 to 39 being the top 3 areas, with that under 20 being our school age population or age group. Just one more slide on that, the last 30 days, so it's looking out a little bit, looking back a little further. The point I want to make here is that 0 to 9 group showing some higher case rates, almost doubling up on the 10 to 14 age group in the last 30 days. And then just pointing out here the impact that it continues to show in the data around racial disparities. So this really shows for, in the county, that populations of color are all higher in the case rates, cases, hospitalizations, and deaths than our white populations, and disproportionately impacted in the county. And that's been a pretty consistent trend throughout. Our school district data is harder. All we had was the summer school programming. So we had 7 cases, 3 positive staff cases, and 4 positive student cases over the summer. The majority of our programming was in June and early July, so the surge we're kind of seeing with the variant right now, a lot of our programming is over for the summer, or we're not being impacted because we don't have that kind of data. But you can see here on the slide the buildings where we saw some of that activity with positive cases and no known close contacts. And we figured we had maybe about 1,800 students who had an opportunity to participate in one of our programs. Some were shorter or longer than others. And we had about, I think it was about 800 staff, I think, that were somehow involved with some form of our programming during the summer. But they were all happening at different times throughout the summertime. When it comes to vaccine, both the CDC and MDH are encouraging eligible staff to get vaccine before school starts. I think everyone knows where to find that information on the Minnesota.gov site. The county's data right now is 77% of county residents 12 and over have received at least that first dose. We know from our survey, kind of late winter, early spring, that the majority of our staff were interested and they were getting that vaccine. So we feel pretty confident that the majority of our staff have had that. We know they've had the opportunity, and we think the majority have been able to do so, if they choose. Some new updated data on the Delta variant. So this is what we're getting from the county. Updates, and there's a few slides in here that updates us on this. So the predominant version of the virus is the Delta variant. 92% of new cases are the Delta variant. Spreads easily. The incubation periods of about 4 days. We know in the earlier timeframe. It could be even as late as the 14th day. So it makes it more contagious and more transmissible in that regard. We also know vaccine's highly effective against the variant, and we are seeing some breakthrough cases, but they're generally mild. And we also know that those who are symptomatic can spread, and there's also impact around asymptomatic folks as well. So the county suggests that the impact on vaccinated is more severe illness than previous strains with the Delta. This, I'm going to transition a bit to our preparedness plan that we've been working on and putting in place for the start of the year, and it is available on the website at our COVID-19 hub. We've been working hard to follow the guidance by the MDH, really trying to ensure that a few things. We want to ensure sick staff and students and community visitors stay home when they're sick, and we have prompt identification and isolation of sick persons in our new plan. When it comes to social distancing, the recommendation is 3 feet whenever possible, and we've been really open about the fact that's easy to do in some spaces in our buildings and others not happening. We're not able to do that as easily in our bigger buildings, especially in more common areas in the schools. We will also continue to look at that 5% guideline when we think about quarantining. So last year at the end of the year, we remember we saw illness happen in a building. When we started getting close to 5% of the student population in a building, we would start talking with public health around what might be going on, what's behind that, what are the causes, and how can we mitigate. So that's a really good approach. That was a guideline that we were using well before COVID. We used that with flu or other illnesses if there was some kind of outbreak in a school. In addition, we've talked about vaccine being available. Just want to be clear, we're not requiring proof of vaccine for students and staff. We've been hearing different levels of government begin to talk about that. We're not there as a school district, and I don't see that necessarily coming anytime soon. I really feel like that's more of a state kind of decision than it would be for us around vaccine, but things are continuing to change. So students and staff this is a key piece too. When we have this coming school year, students and staff who are confirmed cases of COVID, we would be asking them to self-isolate at home, and students and staff would also be asked to quarantine at home should a member of their family or household test positive as well. But we will not be conducting contact tracing and pulling kids out of school for close contact purposes. Families in the classroom would be contacted of a positive close contact and told to monitor their child for any symptoms. So it'll be up to them to be watching for those indicators. I mentioned earlier this afternoon, MDE came out. There's a new COVID testing program. We got a little taste of that in the Health Commissioner's press conference at 2 o'clock, and then there was a commissioner call with Heather Mueller at 4. We don't know all the details on this. Troy Schreifels from our COVID team tomorrow will be attending a webinar on what the options are and what program possibilities and opportunities there are, and that team will make recommendations to me following the full review of what those testing options and recommendations might be. So we just don't know much about all the details that the state is offering up now because it came late in the day. Some additional pieces here, I think it's important for us to point out, still the really high importance on hygiene, hand washing and hand sanitizer. We'll talk more about face coverings in a minute, how important that is. Cleaning and disinfecting, such as cleaning high touch point areas, minimizing sharing of materials, and then our ventilation efforts, we're going to continue with what we started last year by extending our start and stop times to ensure more fresh air is brought in. And then also, I'm just going to keep pointing everyone back to that COVID-19 hub on our website with all the details on some of those particular mitigation efforts. So what I wanted to highlight some of the guidance we got here just in the last couple of days from Hennepin County. So what they shared with us, Troy was on the call with me, with the epidemiologist from the county. With the variant being more contagious, cases are increasing from what they're telling us among children and adolescents, and they're seeing a rapid increase in case growth. They're having a hard time at the health department, at the state level and the county, keeping up with confirming cases and getting communications out and following up on those cases. Their capacity's been a bit limited based on how quickly this is ramped back up. They're reporting 85 to 90% of the cases are Delta variant in the county. And they're also telling us that the Delta is more transmissible, more than 75% more than the original virus, and 50% more transmissible than Alpha, which was the B117 version. That was most common in April, kind of in the spring. Hennepin County, their language was they have major concerns with people under 12 as they're currently ineligible for vaccine. I'm also hearing now that that vaccine is not going to be available until maybe January. We were hearing and hoping it was going to be September, and that seems to have changed from what we're hearing here early this week. They're also saying that testing availability has been a huge barrier. So many of the testing clinics were closed and now maybe trying to reopen. So it's put pressure on people going to their local physician to get tested, and that's a bottleneck trying to get in to see their doctor versus a public testing availability option. To touch on the State High School League, their recommendations were again for those ages 12 and older to receive vaccination. They're recommending that. And then when it comes to mask or face coverings, recommending and encouraging individuals when they're not participating or like actively competing to have coverings on. They did include universal, their position is universal indoor masking for all students, staff, teachers, and visitors to K-8 schools regardless of vaccination status is recommended. They're recommending 3 feet of social distancing whenever possible. We talked about that. Sometimes being a challenging thing depending on the environment. And then testing, students and staff who are not vaccinated should get tested regularly, and when we've probed on that, they mean weekly, is what they advise. We reached out to our coaches and music teachers, and there's a general recommendation that they'd like to see us requiring masking for sports and in our music classrooms, and our music teachers really stress the risk of aerosol spreading during those music activities, whether it's band, choir, or orchestra. The metro-wide school districts, to give you a flavor of what's kind of happening around the metro, it's changed. A week ago, I would say 70+% of the districts were when it comes to mask, recommend but not require. And now we're seeing about 50% of the districts move to a requirement of some kind, or there's board meetings planned this week and into next week for some districts. And so there's been a shift beginning, and there's another survey that just went out today because it's changing so rapidly across the metro. As it applies to our current neighbors, if that's helpful, Wayzata hasn't made a firm decision yet. Last night, Robbinsdale did vote to go full mask. I think it's over the age of 2 for everyone. Elk River and Anoka are still recommend but not require. And then we have, as you've seen, other districts around the metro, like Minneapolis, St. Paul, Brooklyn Center, Richfield, Hopkins, St. Louis Park, Fridley and Mounds View, Columbia Heights, 287, all have moved towards a required mask, either resolution or policy. So just to give you some sense, and then some others have been looking at, I think Bloomington today announced 12 or under the age of 12 is their mask requirement. So there's still some others in the metro that are making their decisions, and I think those are going to be happening in the next week or 2 weeks is the way it is shaping up. I know there was a conversation at AMSD this past week, as Kelsey was there too. From a district leadership perspective, I reached out to our district leaders who have went through so much the past year with going through all the learning models and trying to make all these operational things happen, and asked what's their recommendation to me as superintendent. And over the last couple of days, just collecting all that feedback. The general consensus is all of our district leadership groups, including cabinet, our COVID response team, which did all of our contact tracing work last year, our incident command team, our building principals, all recommended. I kind of asked for recommendation, stay with recommend and not require, go with under 12 and under or under 12, or all grade levels and even over the age of 2. And those groups universally recommended requiring masks to start the year for all groups over the age of 2. And I know Kelly went a step further, as he tends to do with our teachers union, and did a survey. And over 60% of our teachers, I think they had well over 700 respondents over the weekend, or their majority said, yes, we should be looking at masks for all. So just another piece of information I think would be helpful because we've all been seeing the emails come in. We've received, as of noon today, it's probably been more since noon, we had over 402 communications. And of those 402, we had 308, 77% wanted masks to be required. 94 of those, or 23%, support the current plan that we have of recommending but not requiring masks. So we probably got more this afternoon. It's been hard to keep up with everything. So I'll kind of wrap this up in closing, because I know there's some comments and questions. And, I'll just kind of acknowledge the fact that just how difficult this is. No matter who you talk to, it's divided. It's a challenging topic, just this mask topic alone. Our board's divided on it. Our community's divided on it. Our state, beyond, right? It's been a really challenging topic. So I've had to kind of center back on what's my job and what's my role as superintendent, what you expect me to do. And I think for me, it has to start with health and safety so that we can have kids healthy in school to learn to meet those targets that we've been talking about with our strategic plan and academic excellence and other things we aspire to. So when it comes to how do we do a safe and healthy learning environment for our students, staff, and our community and visitors that come into our buildings, I come back to, we all agree that in-person learning is where we need to be. So I'm like, how do I ensure that happens? And for me, where I kind of land on this, and it's a challenging one, but for me, I think it's to start the year is to mandate and require universal indoor masking for everyone in our school settings ages 2 and older, including students, teachers, staff, visitors, regardless of their status, until we can have a better sense of what this variant's going to do. It's based on strong guidance from our state and county public health. They're the public health experts. I'm not that expert, as much as all the experience of the past year you might think I've become one. The recommendations of our leadership, they lived it. They've made these kind of implementation things happen with logistics and moved in and out of learning models, and I think would all say we don't want hybrid. We don't want a global distance learning program. We tried hard and did a good job, but know that in-person is really where we need to be. And, we've obviously had the variety of input from families and caregivers who at least have chosen to reach out to us. So my recommendation that I'm going to ask the board to discuss and try to come to some direction on is, I think, for this kind of a decision, normally it's an operational thing, usually probably falls under a superintendent's purview. But this has such a political nature to it, I think it's really a decision the board has to make. And so my job's to bring you a recommendation, and you're either going to support it or you're not, right? That's just kind of, I'm giving you the information that I get in my role and bring that to you. So my recommendation is the board does vote on that, and I think the way to get it done is through a resolution that would be developed by myself and Tim Palmatier, mandating that we use masks in all of our public buildings starting on September 8th, because we still have summer guidance in place from the state. I would recommend that happens through that resolution process at a special meeting. I would recommend this Friday, August 20th at 7:30, so we have given families ample notice, our staff ample notice, because we have staff returning to work next week. New staff start next Monday. I don't believe it's wise to wait till our August 31st board meeting. That's just not enough lead time for families who want to know where we stand. Again, my recommendations based on the information from a variety of the sources I covered tonight, CDC, MDE, MDH, Hennepin County. I just really think that consistent and correct mask use by people who are not fully vaccinated is really important, especially indoors and in crowded settings. And we know for our youngest learners, it could help us stay in that in-person learning environment. But it's not alone. It's just not that. It's all the other things I covered tonight. It's vaccine, it's hand washing, it's staying home when you're sick, it's proper ventilation, it's cleaning and disinfecting, and all those mitigations that are layered really are going to make the difference in total. And I just believe that, for me as superintendent, I can't go against that public health guidance and the experts that have that data and science available to them. And I think for me, I side on using an abundance of caution and safety for the well-being of our students and staff. And ultimately, I want us to be in person and stay there. It just kind of comes down to that for me. So I don't want students missing school due to illness if we're trying to get the results we desire. So I believe with implementing the mask requirement, hopefully it's short-lived, that would be my hope, is going to give us the best chance to continue with in-person learning and minimize that likelihood of students missing school due to illness. So I think you kind of know where I've come to be on this after really trying to collect as much information as available right now as of today. So I guess with that, Chair Dustin, I'll turn it back to you to facilitate the discussion with the board regarding that recommendation.
All right. Thank you, Superintendent McIntyre. So I think what we'll first do is go around the table and just hear from each board member if you have any comments, questions, or clarifications from Corey's recommendation. Eventually, what we'll want to do is hear from everyone to see if you support moving forward with Corey's, Superintendent McIntyre's recommendation for the resolution at a special board meeting on Friday, August 20th at 7:30 in the morning. So that's where we want to go with this conversation. But I will start with Director Simons.
Yes, I have a few questions. So we've had some back-to-school orientations, right?
Open houses?
Okay. So,
I don't know if we've had many open houses yet.
The 31st, I know.
Yeah, because our staff aren't back to work till the 30th. So
Okay.
most of them are probably that week.
okay. And so what I'm trying to understand is for any of the activities that have been going on, I know we talked a little bit about summer school, but that was earlier. Do we have any of our own district information related to our own activities, if the sports beginning to start their activities? Are we seeing when our students are congregating together? Do we have some insights or information from that, or not enough yet?
Sports just started yesterday, so we don't have any data on that. I'm looking at Troy a little bit, but other than the summer school programming. Summer school is starting to wrap up. Maybe Troy, come up and, so at least your voice can get on the mic.
Summer school is starting to wrap up, so that's starting to wind down. We are, as Superintendent McIntyre mentioned earlier, it was really busy in July, but that's starting to wrap down. I know that my team in transportation does a lot of open house orientation, helping families connect with busing and transportation, and most of that will start in another week and a half. So they'll be going to all the different sites from that perspective. I mean, there's professional development that's occurring within the district and within even the ESC here. So we're seeing some of that start to pick up. But we're just on the front end of it.
Okay. So we kind of went through a lot of general information, but we didn't say because of specific parameters, we would make a masking recommendation for a masking requirement. So when we say that we want to start the year in a masking requirement, do you have in mind parameters that would say specific things when they meet a criteria would indicate that we can move to recommended?
Yeah, I asked that guidance from our public health officials, and their best guidance right now is when we get, remember that color chart, the state, when we get to the moderate level, so we get out of red and orange into yellow, that's when they recommend we are able to move to more of a recommend and not require.
So the main data, that's the main data point for us to use.
Until we get back and know what our case rates are, we don't have, all we have is from last year.
Okay.
And that was different because we didn't have all the vaccine available that we have now, so.
So if we go forward with a Friday emergency meeting, would you envision having any specific criteria of, besides that data point of moving to recommended, that if we, like, returning to, after a period of time, using the 5%, which we were using at the end?
5% is a good measure for considering quarantining school or even a grade level. And we've even had classrooms, right? So we've had to look at maybe quarantining in those cases. So that's the metric for that kind of decision. I'm reluctant to say, here's the metric for us to move to, the public health experts are the best for that. So if Corey puts out at 40 per 10,000, that's Corey guessing on a public health decision that I'm not qualified to make. So I've struggled with that because I think, wouldn't that be nice if we had, when we hit this target, that's when we back off? And the best guidance I've gotten so far is not more of that case rate moving into that moderate range. So I will add too, if the board does move it forward with a resolution, we would do the same to move that other direction. We would come to the board for action or vote to move out of that resolution, right?
Okay, so it would be a kind of an open until some point in time when another resolution comes to make a change.
Well, or until I learn more about a better way to know what we're dealing with in our district around what's the impact in our classrooms. But I think we're,
And I think it's important to note that the Delta variant and the changes that are occurring right now, we're on the front end of it, so we're trying to learn. I know last year we saw benchmarks, and I think that's what I hear you kind of like, what's the benchmark or the number that you can make that informed decision? And right now, we don't have any benchmark guidance that says this is the perfect time to
Yeah.
change from X to Y. And I'm not going to debate if last year's benchmarks were ideal or perfect, but that's one of the things that we're seeing. And so what I would offer that as we look at what point could we turn it off, as a suggestion when we were talking to Hennepin County and talking about what those numbers look like, and the map was red and orange in areas as that comes down. That was one idea. But as we continue, we'll look at it weekly. I mean, I shouldn't say weekly, we look at daily. And we're trying to make assessments on that and getting information, and then I'm presenting recommendations, normally to Ron and then through, but it'll be with John here soon, and providing that information, because we want to be as mindful as we can, because we know how equally divided people are about that. So as aggressively as we are looking at today, we'll be doing that every day as we move forward.
Right, and I'm really asking the questions for the purpose of reflecting that families are going to feel that their children are being denied access to education one way or the other. If they have to wear a mask and it's difficult for them and it's a barrier to them, they're going to feel that they're not being able to access education, that they have a right to access, and the same way other families will feel that it's not a safe environment. So
I think your comments are great in the sense that, like them or not, before we had some parameters from the state in the past, and now it's really fallen on school boards and superintendents to make some tough decisions
Right.
without really living in that world very much.
Right.
So I think, how long does this go? I think it's the board to really help determine the duration of that requirement, and we would continue to watch the changes to all the information that we have, and just continue to watch what happens. So
yeah, and so again, I'm just reflecting community input, that families won't be able to have an understanding from us that in either case when to expect a change as they're preparing to make the best decision for their kids. And I think we're going to see de-enrollment in either case because of the unique situations of families, and definitely very difficult situation for all people concerned and for our scholars. Those are the questions I have at this time.
Thank you. Director Grady.
Well, first of all, thank you, Superintendent McIntyre and the entire administrative team, including yourself, for taking so much time to gather all the data so that we can make the best recommendation. And I really appreciate your thoughtful planning for the safety of each and every scholar this year. I also want to let our community know that thank you for the robust community public comment. We have heard from parents, grandparents, teachers, staff, scholars, and community members. Your fear and anxiety about your children's health and safety has weighed heavily on me. I hear you, and I am listening. Your input is so important because it informs how we will meet the needs of our school communities, as well as each and every scholar. On an individual level, I get it. I'm tired of wearing a mask too. In June, it seemed like we would all get to go back to normal. It was a fun month, and then the highly contagious Delta variant took over and exponentially increased the number of cases. And looking at the data that Superintendent McIntyre and his team presented tonight, I'm disappointed about it too. But the truth is that public health is about protecting the community. Public health is about following science and the medical community. As a district, our goal is always to optimize the health and safety of each and every student. And masking is something that we all need to do in order to keep our kids in school. Required masking is an important mitigation to keep classes and schools from having to go back to distance learning, an outcome I think we can all agree is not what our scholars and our families need. I support a resolution to require universal indoor masking for all scholars and staff, including those who are vaccinated. I believe that we must do this to protect the children ages 12 and under who are not yet eligible for vaccination. I believe that we must do this to prevent the spread of the Delta variant, and we must require masks for a consistent and optimal virus containment to keep our communities safe. Thank you.
Thank you. Director Brooks.
All right, I do have a list of questions for you, and I apologize in advance if I hop all over. Director Simons did take a couple of them that I know I've asked you one-on-one, and so I can skip those. Actually, let me take this off. So yeah, first I just want to say thank you to you and the rest of the admin team for all of the work so far. I know that it is a lot of time being spent in all of these meetings and taking in all this data, time that's being taken away from our other priorities, particularly, academic achievement. One of the things that you said I thought was really important was that our goal is to get to what was probably my biggest complaint and critique last year, and it's that we weren't consistent, and at times it felt like it was chaos. And so that is my goal as we go into this next year, just consistency, more so for our scholars, more than anything, but also for our educators and ESPs, as that ultimately influences how they interact and teach our kids. But one of the questions I have, just some of the things that have come up, you already talked about 279 online in the beginning. Is there a deadline for enrollment? And are there any capacity constraints that parents need to know about?
There's not a deadline in the sense that we're still taking enrollments, and, so I'll give you an example. We had 140 new enrollments, I think earlier this week. Our previous high was 4 years ago of 102. So we're seeing some pretty record numbers coming through the enrollment center. So it's that administrative capacity to move through those applications and get students placed. But we had an enrollment meeting this morning, and we have capacity at every grade level still. So, once we get past the start of the school year, we're still taking those, but we're hoping students can start, on time, well ahead of that. So we're doing the best we can to process all the enrollments as they come in up to the last weekend before school starts, right?
Okay, so I know a parent wrote in about being waitlisted and needing to make a decision. I believe it was yesterday.
Yeah.
So
There's no wait
they-
list. It just
okay.
takes time to process because we have to get all the paperwork and we make sure there's a room available. And and then we go back to check with the family. Do you still want that spot, right? So there's a process that goes through. Usually takes about 2 to 4 days, but it's not a wait list. It's more of just any enrollment takes time to get all the required documentation and verification and then confirm one last time with the family that that's indeed what they want to do. I know I've heard that a few times, and I just want to,
Yep. Yeah.
there's no wait list. People think wait list like it's full. That's what wait lists mean, I think what maybe most people think, and we're not full. Yeah.
In a lot of the meetings that you've had with the state or county, any health officials, have they talked about any sort of lessons learned or just learnings in general from other school districts that have actually already started, likely outside of our state? Are they noticing any trends there that we should be concerned about?
Troy and our lead nurse have been on the nurse calls where a lot of the MDH information comes, so I'll give Troy a chance to respond to that. I mean, we're aware of what's happening in other states, but then we always pull back to, well, what's our reality here,
Yeah,
right?
which is unique.
We're not Arizona, we're not, other states. We've seen some states even require vaccine for staff, right? That's not us. So we're aware of those things, but it's really pulling back. There's maybe been a handful of districts that have started already and they have to get permission from the state to start early because of construction. So otherwise, the state law requires after Labor Day. So there's very few that have already started, so there's not much to learn from other districts. I don't know of any metro districts that have started yet.
No.
And they haven't been in session long enough to really tell us much. and it depends on where they're at in their own decision-making as well. So
Yeah.
I don't know if you want to add anything based on the.
No, I think,
health or
you know, in most of the calls that we've had, lessons learned for them are they continue to advocate for mitigation and the layered approach in mitigation, and they've shared that routinely. They do from time to time, they'll share, you know, insight of things they're hearing, just like what we hear regarding other states and what's occurring down south and in some other areas where school starts. You know, I have family that lives in Arizona, and they've started school almost, they're 2 or 3 weeks in already. And so, but MDE and MDH tend to refrain from sharing some of those perspectives, as Superintendent McIntyre shared, because there's so many other variables that are applied by state. And then, you know, we have, I would say we're pretty fortunate. We have a pretty high success rate of vaccinations in Minnesota, so I think that's a little bit different for us, and that's why we're not seeing some of that. So we continue to monitor that and continue to look at it, but their biggest message to us is the mitigation strategies that are in place and continuing to support that. That's what they keep repeating.
I'd probably add that the tone of the conversations are they really expect districts to follow through on these recommendations.
Yeah.
They don't have the ability right now to mandate or require.
Yep.
I think they would if they could, if I'm being honest.
And it depends, on each call, it depends on who you're talking to. And when I say that, you can talk to MD, and they would strongly recommend and wish they could. And if you get on the nurse's call and you talk to the public health officials, they wish they had a larger stick to say, we want to have this happen. So each group has a little different perspective, but I think they're all on the same page when it comes to that.
As they are referencing research, has anything come up about potential harm to school-age children having to wear masks throughout the school day for extended periods of time?
We've not been provided specific research in that regard. I know that's a concern. We all have that concern, I think, to some degree. And, you know, what I would probably offer up, but that's the best I can.
Yeah, I think so. Yeah, just a couple more. One was just wondering if there are any plans that you know of to have another sort of voluntary vaccination clinic in our district to make it, you know, more easily accessible.
We strongly desire to do that. We're trying to work, you know, last time we were able to partner with Hennepin County, and it was mobile. So that was a really helpful tool for us to make that available in multiple parts of our district. So we're trying to make that kind of partnership happen again. We've been in regular contact with the group that's helped us do that in the spring. So yeah, we have the desire to do that. We just need to get the logistics in place. And also, you know, summertime's a weird time. People are doing their own thing. And so once we get through later in August, I think we'll have better maybe attendance at that kind of clinic once we're closer to the start of the school year. People are kind of more home and not traveling and doing whatever they're doing right now too. So we've wondered about the impact of offering something in the summertime. I think what's a little bit of concern is what we're seeing is that counties are trying to reopen or maybe look at their community clinics, right? So they're focused on getting those back open again. So we're maybe down the list of who to work with in the short term, although as we get closer to the school year, I hope that changes, right? And at least for the 12 and up age group.
Yeah, I just think given, you know, the number of, well, I guess kids and adults that will be in a given classroom or even in the building at one time, I do think we might need to start asking or knocking on some doors to try and make that more easily accessible.
I think there's just a little bit of a capacity question with the county.
Yeah.
You know, I think even our Brooklyn Park site closed, and now it might be reopening, and we're getting kind of conflicting information about what's happening with that particular, even just that one site, for example, right? So we desire to get there, right? That's our goal, is to try to make that available if we can.
The last one was just about quarantining, and I think I've talked to you about this as well. I know it's a little different this year, not being in the land of mandates. But yeah, just some of my concerns as it relates to forcing kids that have been exposed or that may have come into close contact to quarantine. One, making sure that we're being proactive and making sure that there's some flexibility in terms of instruction, that they're not falling behind, and that we're leveraging technology in any way that we can. but also that we're taking into consideration equity, knowing that Brooklyn Center and Brooklyn Park are the highest at this point and will likely continue to be. My concern is that many of those kids will end up having to quarantine and end up falling further behind. So yeah, just wanted to know what your sort of thoughts were on that as we get closer.
That's a big challenge. We don't have the capacity to, for individual students, if you're going to be home in quarantine for 2 weeks, to have you participate virtually in a classroom. At the elementary level, it was really tough. We found some ways to do it in part at the secondary level last year. And we don't, you can't just move students into 279 online for 2 weeks and move them back out.
Yeah.
That's not how we built it. We don't have the staffing or the class, that would throw off class sizes and instruction, and it'd be more of maybe a detriment than a help, even though good intentions.
Yeah.
So now if it came to a point where there was a classroom or a grade level that we had to quarantine, now we have online status, and that allows us to potentially, if Corey's the teacher for that classroom, we can do that for that period of time, whether it's 2 weeks or 4 weeks or however long it needs to be for that time frame. So I saw Anthony here just a minute ago, he must have stepped out. But we've been continuing to wrestle with this. It's really challenging if it's one student at a time, if it's a classroom or a grade level or even a school. Now we can do that structurally. We can use the staffing we have in that school to deliver on that, right? So
I want to clarify too, Director Brooks, are you referring to students that would be quarantined for positive cases? Because obviously last year, we moved and shifted a lot of kids to quarantine because of close contact, and that would not be the case this year. So you'd see a significant number of reduced quarantines, I would think, based on what we saw from last year. And so obviously there's still going to be that same challenge with those kiddos, but I don't think you'll see the numbers that we did last year, and that was a big challenge for families. And I think as board members, and I know for my department, we just got beat up hard because kids were moving in and out. Some kids were quarantined, and then they came back, and then there was another positive within a classroom, and kids were re-quarantined again. And with this practice this year, I don't envision us seeing the same kind of numbers.
I know that we're in a different position now, just having so many in the metro vaccinated.
Yeah.
But what are our notification protocols in terms of a student being confirmed positive for COVID?
Well,
For the other,
there's two ways that we're notified. We're typically notified through the,
how are we notifying parents is what I'm asking.
how are we notifying parents of
The other parents.
the other parents? So when we have a confirmed case, we have a process that our COVID team goes in, they review all the information, and then they'll make a communication to the impacted students in that classroom through electronic or phone method. So the families are communicated, notified of the incident, and are informed to watch and monitor their student for symptoms. That's the new procedure for this year.
Okay. Thank you.
Yep.
To answer your recommendation or to respond to your recommendation more directly, I think just, given the recommendations, I know that you've been at the forefront of a lot of these discussions and taking in a lot of this research. Given where numbers are today and how rapidly they're increasing, as well as taking in the feedback from the community, which I know you also highlighted. To me, getting back to that goal of wanting to be consistent and not having to get into a situation where the state is coming back in and mandating that we change learning models or any of those things, I am in support of requiring masks this fall or at the start of the school year. I would like us to be more proactive to Director Simon's questions and comments to look at some sort of model or decision-making process so that families can be prepared and know in advance sort of what criteria we're looking at to get rid of that mask mandate. But right now, I do feel like it's the right thing to do to start the school year out with masks.
Director Douglas.
I have a couple of questions I want to start off with, and I also may jump around a little bit. my first question actually is, were we provided that slideshow? Because it was not in my agenda.
No, because I literally was in with the State Department at 4 o'clock, so I
Okay.
walked into the meeting with it like I had to do often last year. Yeah, it'll be posted tomorrow once.
Okay.
But we were literally, Kate
was
and I were
just-
working on the slides
Yeah,
when I walked into committee at 5 o'clock, so, yeah.
okay. Yeah, there was just a lot of data that I would like to
Yeah.
be able to look at more
We were
closely.
waiting on the testing piece for one, and that was really late in the day. So, sorry about that, but
No,
it
that's
happened a
okay.
number of times last year when we had meetings on Tuesdays, and that was the day we got the state or the county data.
I just wasn't sure if I missed it because we have received so many emails in the last couple of days. So thank you for clarifying that. One of my questions is about teachers and when they're quarantined due to a positive case. What kind of benefits will they have? Or like job security, subbing, all the things related to what happens when a teacher's not in the classroom.
I'm guessing Laurel's walking down the hall, we could probably start hearing her shoes on the concrete. I know, Troy, we probably talked about this. I know we hung on to that additional sick leave time for this year, I believe.
I usually always defer to HR when it comes to those
Yeah,
questions.
So we hung on to that just in case teachers needed additional sick leave if they had a positive case. Now, I think they have to confirm or show us that confirmation to be eligible for that additional time. It's the same provision we had in place last year for staff.
Here she comes.
So, come on in.
You answered it, so I.
Okay. Well, you might be able to say it better than I did, so.
So I don't know if I heard the whole question, but for all of our staff, we are reinstituting our emergency sick leave. So it's 10 days of emergency sick leave for the reason that if the COVID team tells a staff member they need to quarantine. And we're starting over, so it doesn't matter what they used last year, everybody's starting over at 0, and they'll have up to 10 days of emergency sick leave to use.
Okay, so I actually have a follow-up question to that, is a lot of our teachers are parents, and it's recommended that if you have a household member who tests positive, that they also quarantine. So if you're a teacher, you've tested positive, now you just got out of quarantine, you get to go back to school, now your child tests positive, what options do teachers have in that case?
So if my understanding from the COVID team is that if there's a household member that tests positive, you are quarantining, so then the COVID team is telling you, you must quarantine,
Yep.
and you can use the 10 sick days.
But yeah, so you just said they have 10 sick days, but if they're a teacher and they have to quarantine for 10 days because they have it, and then after that, one of their household members tests positive, then they don't get paid, or like what happens?
They can use their own sick leave. We've also extended our short-term leave, so that would be without pay. We did not run into that situation last year, so I'm hopeful that we can work collaboratively with the employee if that
Those
happens.
10 days are in addition to their normally accrued sick leave.
Correct.
So it's an
And they
addition.
have some other leave options if they needed to use it.
Sure. I guess I'm thinking about like our younger teachers who are the ones who have younger families and things like that, and especially if this Delta variant is as contagious as it is being made out to be, then it would stand to reason that it would be very likely that students or families, teachers with students would be faced with this situation, especially if they live in a different district and their kids have different exposures, they're not in the same building as their parent, you
So
know.
That didn't happen last year when we had 5,500 quarantine students.
It
That-
did not.
Okay.
We also did have some options for staff to work remotely. We
Oh.
did not have that this
Okay,
year.
good point.
But I don't know with the COVID quarantine, if a staff member is vaccinated and a member of their household, can they go get tested and come back early, or?
So if they're
I've-
vaccinated, yeah, and they test, they could come back early. I would say that, well, I shouldn't say, because every situation is personal to the person, and the situation can change, but I would say there's a lot of different options for returning based on testing and based on the quarantining that we have. We saw a lot more teachers go out last year because of close contact, and, again, if they're vaccinated and if they get tested again, they could come back, so I don't know that that's going to be as big an issue as it was last year.
Sure. Okay. I guess I would ask that we maybe evaluate and have a process for handling that situation, should it arise. And then I also have another question about students who a lot of our families have multiple students at different grade levels and at different sites. And, Thomas asked some really good questions about how we maintain their learning. And I think about my own household, all of my kids are actually now I'll have 2 at the same site, but 3 different sites and different grade levels and different things going on. And if their learning is disrupted every time, like if, let's say, they consecutively get COVID, then that's a lot of disrupted learning for a really long period of time. And I know that that's not unique to my family. So how are we going to handle the learning for those students?
Well, a couple thoughts. If they're positive cases, I would worry, first of all, are they healthy enough? What's their health status, for one, if they're ill. Usually when they're ill, previously, the teacher and the school work with that family and student, depending on how healthy they are, to even participate in learning. So that would continue to happen. If a student got COVID multiple times, I'm not sure we've.
So I guess what I'm talking about is specifically, so I'm just going to use my family as an example. My oldest child gets COVID. All 3 of my younger children have to quarantine. They're not sick, but their learning is disrupted. Then my oldest gets well, my next gets it, and the other 3's learning. Exactly. And that's what I'm talking about, is because we could have kids out of school for a month or longer if that happens in their family.
Yeah, right now, what we don't have the capacity for is teachers to teach their live class and teach a virtual class at the same time. That was our challenge last year as well, right? So we'll have to continue to evaluate those kind of scenarios, I guess, and see what we can come up with. I don't know, Anthony, if you have any thoughts on that as well, but we've wrestled with that. And right now, if a student's out due to illness, we're doing our best to provide them with work, whatever they are able to complete. Your scenario is a little different. They might be not ill, but quarantined because of a family member being positive, right?
Right.
So we'll have to continue to evaluate that, and I can maybe follow up as we continue to figure out what we can do in a scenario like that.
Yeah, and each scenario is unique. I will offer, I experienced this in my family last November, and I would say the Delta variant, and I'm not a public health expert, so don't stamp and take it to the bank, but it happened very aggressively and very quickly in my family. And within a 14-day period, we were almost cycled through, 14 to 20 days cycled through, but it's to your example. So, you typically are not going to have 10 days, 10 days, 10 days, and 10 days. So I don't know if that's what you're interested in or we're curious about, or.
We're very focused on getting our kids back to school and in-person learning, and we've discussed multiple times about how critical that is. And we've got a lot of families in our district who have large families and varied age groups and varied levels of protection, varied levels of ability to be vaccinated. And I am, I feel like, there's been a lot of great work done, but I feel like we have a lot of unanswered questions about how we're going to maintain learning. And that needs to be our priority. We're an educational institution, and that's what our job is. So I want to focus on having plans in place for those situations, because they are going to occur. They might be infrequent, but they will happen. And so we need to make sure that we have plans in place, and it feels like right now we don't have plans in place.
Our plan in place right now is they work with their teacher to complete work as best they can while they're sick. That's what we've always done. Now, if it requires additional staffing and resources, we'll come back to the board and ask for those things, whether it means an additional teacher at every school and finding the money to say that that's your teacher that might teach kids who are quarantined, who are positive cases. Those are some ideas we could work through if we're seeing the need for that, right? So it's a lot of, as I showed with you earlier, the data's coming at us by the hour, and we're doing our best to react to what we're learning. A good example is not having the packet for you until the meeting, because it's literally coming in right before. So I think there's maybe some options like that. We'd have to figure out how to fund it and pay for those kinds of ideas if you're supportive of those things.
Can I interject just a minute? Do we have homebound?
We do, yeah, but there's criteria for homebound if the students
And
met that.
What's the criteria?
There's a number of criteria.
Temporary homebound.
There's not a temporary homebound provision in the statute. There is, if it's a temporary injury or some kind of disability-related condition. So I'd have to follow up with all the details there, but homebound's usually a longer-term scenario where kids are out of school for beyond 2 weeks.
Well, in this
qualify.
particular situation, they would be.
Yeah,
Yeah, they wouldn't qualify though unless they were sick.
yeah. That's a good point.
So, all right.
Would we be willing to treat it similarly and pay someone hourly to do online as an option?
Potentially.
Not to get into the weeds or anything.
Again, I
just-
got to go back and work that out with our
Right.
team and say what's realistic and what can we do, and what would it require from a resource standpoint.
Right, but there are options.
3 weeks ago, we thought we were starting pretty straightforward, and here we are 3 weeks ago trying to do the best we can to plan for what this might look like 3 weeks from now, right? And that's challenging. It's been really challenging for our team, but I hear the desire to come up with some options that might be able to meet that kind of scenario across our system. If there's students if we see a higher rate of positive cases, how to provide some live instruction for that.
All right, so I have some additional questions. One is about the county data. We have a very highly populated county, obviously Hennepin County. And we're just like a corner of the county. And also, our student population, or even if we encompass, well, yeah, I'm going to focus on students right now, but our student population is an even smaller percentage of that county data. I'm really concerned that we don't have metrics for how we will measure what's appropriate for returning to a masks optional recommendation. And I have concerns about how the data is being used and who is included in that data. And this is also based on cases, not severity. And in a lot of cases, we're hearing that it's variable what the severity is. So, when do kids get to return to school based on the severity of their illness? Like, what's that criteria look like? What other metrics might we consider for implementing a mask requirement and moving out of a mask requirement? So those are the things around the county data, and I can't see it now, and I don't have it in front of me, but there were a few points on there that felt very, I don't know what the right word is, but it just didn't feel sufficient for making such a strong requirement, given all of the other factors involved.
Yeah, my response to that is, it's the best data we got, and I'm not a public health expert, so I'm going to I lean towards trusting their guidance. Again, my job is to be a superintendent, not create new ways of measuring public health illness. That's just how I feel about it, right? I wish we had those, and I want to get there too, and Troy and I talked about on our next conference call with them, pushing them to say, from a public health perspective, give us some ideas on what is that criteria? What is the threshold? Because the minute Corey sets it out there, I'll get blasted for, well, what's your background in that area? You're not a medical expert. So we can't talk with the public, sorry, but we want to get there too, so I'm going to continue to strive to find that. In the short term, my best advice is I'll continue to update the board on what we know and when it comes, and the board will have to decide, is it time to end the mask mandate? And you'll have to come to some agreement on, do you have enough information based on what's available to make that decision? And it's my job to keep bringing it to you, right, based on what we know, and continue to see if there is a way to come up with a framework that health could stand behind, that would say, yep, that's the tipping point.
Yeah, so you've pointed out multiple times that you're not a public health expert, nor is anybody on this board, which is why it is silly that we're making public health recommendations and requirements for our students when that should be a personal choice. This is personal medical decisions, and there's a lot of factors that go into why somebody wouldn't wear a mask. And I haven't heard any exemptions for that. Do you have exemptions for the mask requirement?
Yeah, that would be in the resolution once we're drafting it. If that's the way the board would go, then I would include in there that individuals who can't wear it safely because of a disability defined by the ADA, individuals who it would create a risk for them in their workplace, a job duty, or workplace safety guidelines, or those federal recommendations. Individuals who maybe have trouble breathing, we would not, clearly if they're struggling with a physical unable to move or unable to remove a mask, some of those kind of scenarios, they're rare. Or individuals in certain situations, there's things like, certain activities that you can't wear a mask. So there's some, those are all consistent with CDC and MDH guidelines, and that would be my recommendation. We stay tight with those recommendations as far as any time the mandate wouldn't apply.
Okay, so again, those are CDC recommendations, not requirements, which is why, again, we should not be making these requirements. These are recommendations only. People should be free to make their own choices. Also, can you please provide information about whether or not documentation will be required of exemption
For staff,
for everyone?
well, yeah, if the board sets as their expectation that masks are required, we would need some evidence of why they're exempt, right?
So,
From an HR perspective, and Laura's shaking her head, yes, so.
yes, so
Staff.
from a staff perspective, you would require people to provide personal health information about why they require an exemption. From a student perspective, you would require people to provide personal private health information about why they would require an exemption. Parents who attend conferences or student functions, you'd require them to provide private health information to prove that they have an exemption.
We would require them to have a mask on in those environments.
Well, like if they have an exemption, then they can't be wearing a mask,
Yeah.
so.
Yeah, then we would ask for that proof.
So you show up at conferences and you have to show your doctor's statement that you don't have to wear a mask because you have an exemption? Are we really going to be asking for that?
The challenge of it is enforcement, is your point, right? That is a challenge, right? So I still think the requirement step, for me personally, is the best move here, and we're going to try to use tact in those situations and work with the family. We're not going to just make them show up and sit down and provide a public document in front of a group of strangers. That's not how we operate. So we would work with that family on if there's an issue, what that might be.
So families have to notify in advance before they show up at their child's school.
We would be communicating out that if the board did go down this road, that it is a requirement. So we would hopefully be able to work that out and work with the family around what's happening there. So it seems like a lot of possibilities or hypotheticals that we could walk through in that situation, but I do know that our building leaders and our staff work really well and try to work hard with families on making things work.
Sounds like it would not be very beneficial for our families. My next question is around enrollment. You provided just a tiny bit of information about our 279 enrollment, which sounds promising. It's very great to hear that we do not have waitlists. I know that's been a question I've been asked many times. I've had a number of people tell me they've been waitlisted or not allowed to enroll, which I know is not the case. I'm not sure why that's happening. Do we have any specific information on what has occurred to create these rumors?
So when people apply for 279 online, Anthony can probably explain it better than I can. There's an administrative process in time we need to go through, like I said earlier in the meeting, the paperwork and confirm that there's space available in those grade levels and get back to the family to confirm that they indeed want that spot. So maybe you can add a little more context to that, Anthony.
Yeah, I think you explained it well, Corey. And the process actually isn't any different if a student was doing an in-district transfer, applying for magnet programming. They call it a wait list, but that's more of kind of the holding tank application process. It's more of the processing process rather than a true wait list as you would think about it. So they go in, and the conversation we had with the Enrollment Center today, typically within 2 to 3 days, they're told of their acceptance, then they're given a week to turn in all their paperwork to officially enroll into the school.
So just to clarify, the language that we use when a family enrolls or starts the process of enrollment, we use the language waitlist.
It has been used.
It
and
has
we've-
been used.
We have addressed that.
Okay, so we're no longer using that
Correct.
language? Okay, so that should not be an issue.
I think that's what
going forward.
created some of the confusion.
Okay,
Correct.
thank you.
And it was language they were using even with in-district transfer. So if I wanted to go from Osseo Senior High to Maple Grove, they'd say, we'll process your application and put you on the wait list until we can get through the processing. So it's been consistent language that we've used historically throughout our system, just it has gotten a different context as we've talked specifically 279 online.
Okay, that's very good to know. My next question about enrollment is prior to COVID-19, we evaluated our enrollment and determined that approximately 30% of the students that live in District 279 attend school outside of District 279. And that was before COVID. Since COVID has happened, we have approximately 8% of students who have taken their enrollment to other districts. So we are rapidly declining enrollment, and that is a significant concern in our district. And I'm highly concerned about a mask requirement further decreasing the enrollment and the potential fallout that could happen from that. For example, teacher layoffs.
I would offer that I'm not sure that 8% is accurate. We would have to go back and verify. Our enrollment is daily increasing. August is a heavy, busy enrollment month, so by the time we start school, it'd be a totally different picture than it is today. I think I've given the board updates on enrollment throughout the last few months, and I can say consistently across the metro, 2 to 4% has been the enrollment loss around the metro as far as moving in and out of learning models last year. So our biggest loss, I can say we were about 400 students under earlier in the summer, and half of those were kindergarten, and our kindergarten enrollments have been coming in really, really fast. So I've been trying to give you weekly updates on enrollment. I think you've been getting those, and it's you know, where we'll be in 3 or 4 weeks, it's trending in the right direction. So I'll continue to give you updates as the enrollments come in. We were hoping to recapture 50% of what we lost. That was our goal. And then recapture the additional 25% the next year, and then 25% after that. That was, Ron Meyer had shared that a number of times with the board. So the best I can do to answer your question is I'll continue to update you on the enrollment piece. I think Director Simon said it well. If we mask, we lose enrollment. If we don't, we lose enrollment. It's going to happen either way, and that's been the conversation across districts with superintendents. We're all in that really bad place because of what we're living through with COVID right now. So that'd be my response to that question.
I agree that no matter what, if we were to not mask or mask, we would lose enrollment either way. But I do think providing people with the opportunity to make a choice that suits their family's needs is the best choice. Those are the only questions I have at this time.
All right, Director Mosqueda-Jones.
Not sure there are any questions left to ask at this point. I've been filling in my question list here with other people. I just have a couple of, like, I don't want to say silly, but, because they're not silly, but more specific questions. So we've been getting some feedback that masks can create some social, emotional, and anxiety for kids, and that it may cause some dehydration. I've been wearing a mask all summer teaching because the district I'm in has required it all summer, and I can verify that dehydration does happen a little quicker, if not for real, at least psychosomatically. Do we have, like, again, I'm getting into the weeds, but we had water bottles for every student. Is that something we can do so that every kid has a water bottle that we can put their name on it?
Yeah, I believe we do that
And that we
already.
encourage teachers to have water breaks at certain times, so not one kid feels like they can't go to the water.
I won't speak for
Teachers individually.
yeah, but what I see when I go into classrooms, and you saw it with me, if that's what students and staff want, they have water bottles with them, if that's what they feel like they need.
And with our increase using some of our ESSER's money, we'll have more social emotional support with, for kids if they're experiencing anxiety and et cetera, and to work with families.
Okay.
That's all I have in addition.
Actually, I had one more question that you reminded me of, if that's okay.
Go for it.
So there's been a lot of data around masks and their efficacy, and it's been controversial. Actually, a lot of the data that we've gotten from all sources have been inconsistent and ever-changing, as science is. But there has been a lot of data to suggest that masks are not effective for a whole school day. So how do we plan to handle that situation?
My recommendation is their masks are on all day long. That's part of my initial recommendation. So you probably obviously don't agree with that.
No, what I'm saying is that the mask itself is not effective in preventing the spread of COVID-19 for a whole day.
I'm not going to debate the science behind that right now. That's not my job. My job is to give you a recommendation for, should we be requiring masks for our students at school? That's what I'm recommending. So I'm not, I
I'm
don't,
not asking you to debate it, I'm asking how do we mitigate that?
well, I can't verify or confirm that that's true in the first place.
So we can't verify or confirm that any of the science is true.
But that's,
Okay, so we're going to move
you
on,
feel?
and I'm going to make my comments. I think it's really easy to have an us and them mentality when it comes to this, right? I mean, and what we're trying to get to, because all it does is continue to divide us. I mean, clearly, I mean, I turn on the news this morning, you know, and nationally, it's a debate that is divisive, and it gets away from the core, as you mentioned, Director Douglas, of what we're supposed to be focused on, which is in-person learning. And this is one, you know, when we talk about all this, what's frustrating to me is we got to get back to our business, and you know, masks are one of many mitigation strategies. And I would agree, sure, we've heard a lot of conflict, you and I have talked about that, a lot of conflicting information about masks. And I think that no matter where we land on this, it's going to be, people are not going to be happy. We have 8 cities, you know, that encompass our district. It's one of the most diverse districts in the state of Minnesota. And my concern is what strategies can we put in place to ensure we are in school? So my question to Troy first, and you've answered this, but I want to be really clear so people can hear this. What has changed with this, you know, with Corey's recommendation and things that have, with COVID protocol, with masks, using that mitigation strategy? Because last year, my daughter was in 3rd grade, one of my girls. She, right away, was quarantined in her class. Probably like 3/4 of her class was quarantined. So she's home. Is that the case this year? With having masks as a mitigation strategy, is that the same protocols? And you've kind of answered it in different ways, but I'm just like an example of like somebody's life.
Regarding her being a close contact to somebody that's positive, the family will be notified, but they won't be required to quarantine themselves unless that student has symptoms. Then we'd ask them to either quarantine or get an alternative diagnosis and bring that back.
So we're not going to see droves of students, like 5,500.
Like I said, last year, we had 5,500 students
With this-
approximately that were close contacts to positive cases and were quarantined for that.
Okay. I do have a question about, you know, we've seen some cities, counties passing mask mandates or ordinances. I don't know if this is for you, Tim, or General Counsel, or if you know, but what are the implications? Like, again, we have 8 cities. They're their own governing bodies. So as they may or may not pass mask ordinances, how does that impact our district?
Yeah, we know that one of our cities actually did pass a mask-wearing mandates and applied it to public schools. They, since as of Monday, modified and amended their ordinance, their emergency ordinance, so they no longer applied in that fashion. And I can tell you that I had conversations with city attorneys about this particular topic and whether or not cities, you know, relative to school district authority and the board's authority to regulate schools versus the city. I think a lot of city attorneys would tell you that there are inherent police powers in their charters that afford them the ability to be able to pass an ordinance, an emergency ordinance like that. Obviously, for a school district like us who occupies many different cities, that creates considerable logistical issues. We have one city requiring one thing and another, potentially. That's not our case right now, but potentially. So if the question is, can a city do it? I will tell you, city attorneys would say they absolutely have the police power to do that.
and I've also talked with our city managers, and we believe it's a school board decision for our school buildings. So as a district, our position is that's your job.
And we made that clear as well. I mean, we had concerns about the implications of one city's decision impacting potentially the entire district. So we did raised those concerns.
And I have talked with a couple of our other cities, and they don't have any desire to get into managing the school district's decisions on that. They feel like their jurisdiction is over their governmental buildings, or sites, but not school district buildings.
Okay, so then, you know, I think we've all kind of talked about, like, what are kind of our, you know, really check-in points to ensure that, you know, we're looking at the data, which we know, we're dependent with the data that you laid out, but then as we get back in school, we'll see the impacts of the Delta variant and COVID. You know, so I guess I'm just asking that as we make those determinations as a board, then we're our own kind of jurisdiction in terms of even if the cities maybe have an ordinance, we're still governing our buildings.
Yeah.
So as we kind of have our decision-making model,
Yeah.
it's for us.
It depends, you know, who you ask. So if you're asking a school attorney, I absolutely agree that that's the jurisdiction of the school board
Okay.
and the administration of the school board.
Probably for you still. Are there any liability factors as it relates to recommending versus requiring masks in our building? Like, has there been any from like the Minnesota School Board Association or any conversations? Or
MSBA actually did a Q&A on this topic. They talked about resolutions connected to our masking requirements. I think if I can summarize their position best, and this isn't a great legal analysis, but it's probably fair and true. The more you do to mitigate, the better you position yourself in terms of potential liabilities. So that much is probably true. Whether or not, if, say, hypothetically, someone became infected in the absence of a mask mandate, that they'd actually have a legitimate claim. I mean, I'm not sure about the ultimate success of that. Certainly, the more mitigation efforts that you make, the stronger your arguments is as it relates to potential liability.
Okay, thank you. Okay, so
Can I
yeah, wait, hold on. I'm gonna, oh, whoa, everybody. Let me just say, I'm gonna go around again, and then could you just, some of you have, just articulate, like, do you support Superintendent McIntyre's recommendation for a mask requirement with a resolution at a special board meeting that we vote on this Friday at 7:30 a.m.? Okay, Director Simons.
Okay, yeah, sorry, since I went first, there was a lot to process.
Yes.
Since I hadn't seen that, all the information. So I am hopeful that we can get additional information on severity so that we're understanding not just the spread, but what is a typical duration, and what's the severity, so that we really are understanding thoroughly the impact to our scholars, that we're making decisions based on our scholars in our environment, because it was a little bit challenging, whereas, and I know for you too, to see some of the information that was everybody, some by demographic, some by age, and not every data set had that breakdown. So I hope that we can continue to get some more of the information, so we can really make a decision that's considering it holistically in all the factors. And I do agree that absolutely the best learning model is to ensure that we're in person, but I do want to reflect some of the input from families, and I don't think this is I'm not saying you meant to convey this at all, but it's not just about the bodies in school, but also the ability to thrive in school, and I think that's a lot of the feedback that we've had from families, and many of my colleagues touched on the social emotional aspect to it, the difficulty for, especially that over 2, that's a little concerning for me, that 2 to 4 year old range. That feels a little concerning in terms of masking and the benefits of being in person with a mask on for them. Feels like it could be diminished with that, especially that really young age group. So I do just want to really recognize that it's not just about bodies in the school, it's about the ability of our students to thrive. And I don't think any of us is saying that a normal experience includes masking. That's absolutely not a normal experience, and it's not the best experience. But we also are trying to weigh all of the health and safety factors to make the best choice in a difficult situation. But I'd be remiss if I didn't, call it out given the feedback, and I know I know you feel the same. I think as far as the resolution itself, I'm a little bit concerned about a quick turnaround around a Friday. If we've kind of said there might be exceptions in it, like be able to have the time to review the actual resolution itself. So I don't know if we would consider a short board meeting before the work session next Tuesday, or, I'm a little bit uncomfortable with Friday being like such a quick turnaround, people being able to provide feedback, be able to actually read the resolution and see what it says. So I'm a little concerned about that. And will be interested to see if there's any other input that we might have before the date of voting on it. I'm concerned as far as if it's just open-ended. I might suggest, could we say for authorizing it for a period of time in absence of some metrics that would say it could change if these parameters are met? So that might be another consideration, so it's not just open-ended without criteria. But overall, I'm very supportive of the board having the vote on it. I think that's appropriate for our jurisdictional accountability and our governance and our oversight and accountability to all of the stakeholders of our districts. I don't feel it's right to put our superintendent in the position of doing that, but to bring the recommendation to the board and have the board have the accountability for those decisions. So I really appreciate that, and I know all of the work that's gone into it and putting your best thinking into it, so I appreciate that.
Thank you. Did you want to respond to anything? Okay. Director.
Yeah, I support a resolution. I'm ready to vote on it on Friday. I think delaying, we've got a lot of public comment, and I really appreciate it, and I think our families are ready to move on and start planning for their children's success when they go back to school. And I accept the fact, as messy as it is, that we don't have all the data that we want, but we have enough data to take this seriously and keep each and every student safe.
Okay. Director Brooks.
So yes, I would support a meeting this Friday to support the resolution for mandating or requiring masks this upcoming school year. I do, and I didn't say it the first time, just want to say thank you to, hundreds of parents that wrote in. Very few of the emails were short. A lot of them included a lot of detail and some pretty personal details about their families and their kids. So I read them all. I know we all did, because this was something that we couldn't get off of our minds. So I just want to say thank you to everyone on both sides, or all sides, I should say, for engaging with the board on that. And then I also just wanted to reiterate one of Director Douglas's points related to consistency in learning. So Superintendent McIntyre, you mentioned that you've been struggling to collect all of the data, and even up until today, it took you up to today to create that presentation. But I think we knew last year that there was a possibility that we could have to wear masks again this year. So I just want us to be more proactive in our thinking. I think we're in a different spot this year. We shouldn't constantly be in crisis mode, given the high vaccination rate in the metro. So I just want us to be more proactive and to actually have a plan for those scholars that are going to have to be in quarantine one way or another this upcoming year. So that's it.
Just maybe a comment there. There's two lines of thinking there. I have colleagues that says they're waiting as long as they possibly can because there's something new every day. And so we were out in the front and in July, and that was the risk we took, because now I'm recommending a change because a month later we know something different. So it's really tough to know whether we want to be out front or wait till more information comes in. That's a constant dilemma I find myself in, right? So I appreciate your.
I'm with you.
Yeah.
And I mean, you have a pass now. I mean, we're going into a new year, but just saying, going forward, I would like us to be more proactive in our thinking, so.
You have everything I have. That's my response. Yeah.
Didn't you have another question?
Nope.
Oh, sorry. I thought I had
Thank
heard you say you had a
I
question.
don't think so.
So I agree with the comments that you just made, actually. I do feel like there's certain things that we could have potentially, at least preliminarily planned for in relation to the likelihood that we were going to still be experiencing some level of COVID-19 response. this school year. I also agree with many of the comments that Director Simons made. I did have one more question, which I was going to ask earlier, but I did not get to finish, which was on the masks, would we consider providing or masks for children to switch out of and staff to switch out of during the school day? And if we are not going to do that, then would we be providing breaks or be advising parents on how many masks they should be sending, or what would that look like?
My short answer, and I'm looking to Troy because he's our supply person, we've had an abundant supply of masks, so that shouldn't be a problem if we needed more than one.
Yeah, last year we provided multiple masks, both from the district and from the state. And we're going through right now our inventories of that and beginning to adjust necessary inventories to provide again, because we're going to have new kids coming online that weren't here last year. And we know that, I also oversee our facilities group, and I laugh because we're picking up masks in parking lots and all over the place. So we know that kids lose them, and we know that they need to be replenished. And so from that perspective, we'll provide the supplies necessary. And we also know that we had numerous masks available, and a lot of families took it personal to provide their own personal masks because of their personal likes. And so we know that families will look at that as well. So, but either way, we'll have the supplies available.
Okay, I guess just a little bit more specifically, we've had so many people write in and say things like how disgusting the masks were, the kids weren't washing them, and things like that, or they didn't know, or, I mean, honestly, if you've ever sneezed into your own mask, it does not feel great. It's just not a thing that we want to be experiencing. And so, but I've also heard a number of families at the end of last year commenting how their staff at their site was limiting or rationing masks, or if kids didn't have one, they were being reprimanded for that. And so that's, I think, a concern that we need to address proactively in making sure that all of our staff is prepared to distribute masks to kids who need them or need to change them throughout the day.
So we work with the centralized COVID response team. My team works weekly with each site-based COVID team, and we have weekly meetings. And we've had conversations, I've heard some of that last year as well, and we've had conversations directly with each site to say if there's an issue with supply, let us know, because we didn't have a supply issue at all last year. Now, from an individual perspective, if it's one specific classroom and a teacher or a building, it would come on our radar, and I didn't get that information that we had a building that was either holding them or didn't have them, or not able to provide them, because I had just as many calls that, hey, at the end of the school year, they were asking, what do we do with all this leftover supply? And we said, keep it there. Again, talking about proactive, we did not bring back any of the mitigating devices and equipment that we have. We said, leave it at the schools, because we're not sure what's going to happen coming into this fall. And so we have that available. But again, if you hear or others hear that there's an issue with supply or with the opportunities to replenish a classroom, let us know, because I know I oversee the busing component, and we were providing supply to them nonstop, because kids would get on the bus and not have it, and that's where our first point of contact, so we're always trying to provide that supply to them.
And I think you can take it a step further. We'll do work hard to let people know
Yeah, and-
actively we have supplies.
And
Yeah,
part of our,
yeah.
part of
We'll
our.
wait for that question.
Yeah,
to
and
pop up.
part of our training will be, again, to reiterate the supply chain and how to
Yep.
go about getting that additional supply need. So that's coming out in the next week. We'll be training all of our sites again.
So I have one last question on masking, and it has to do with transportation.
Sure.
I know that much like other districts across the state, we have a driver shortage. And it's an ongoing issue. We have trouble finding and retaining school bus drivers. Obviously, we don't operate that specifically out of the district. We contract that out. But how are we going to be able to enforce the masking on the school buses? I know that was a struggle last year, and drivers need to be focused on the road versus
Sure.
students.
So I've had a lot of conversation with my team and with my contractors regarding that, because up to a couple of days ago, it's always been a requirement on the transportation side from the CDC on all mass transit. So we knew that going in, and we had a lot of conversations with the team on how to best approach it. And just like on behavioral issues on a school bus, our drivers are trained and coached on how to talk to students and work with students and to set expectations early on. And when that doesn't work, they have all those other things that you talked about that they have to be focused on, the safety in the bus and the traffic in and around them. So they have a bus referral process. In that referral process, they fill out a referral form that gets electronically submitted to the school, and the school works with the bus driver and with the student that may be of an issue. The other thing is our schools work really closely, so they have staff on the sidewalk to receive the kids in the morning and to send them off. And that's where that point of contact typically occurs in person, where the driver works with the frontline staff to have those conversations. So we've been pretty successful with that. But as you know, we offer them. We literally will ask the student, we notice you don't have a mask, here's a spare mask, please bring one tomorrow. And I got drivers that came up to me and said, I gave out 100 masks in the last week, and I have other drivers that said they're in full compliance. So we know it's an issue, and we continue to work with them daily, because we want them to start their day showing up to school with a mask on when they get to the building.
Okay, that was my last question about that. As far as the resolution, I really can't say how whether or not I support it or not without having it to view. And I do think that I understand the urgency, and I do think that we should have a meeting on Friday or early next week, because the sooner we have this, the better. But I also have reservations about not having enough time to review it, our community not having time to understand it. So I don't know if we could have that, like, when would we get that resolution, and how would our community be able to provide feedback on that?
Well, we can have a draft ready tomorrow morning. Whether you want that in a board packet, that's published. Like, if we have a meeting on Friday, we got to notice that meeting tonight to meet the notice requirements. And then we could have the resolution drafted tomorrow. So we would have Sherry make that notice requirement happen tonight and then provide you with a copy of that tomorrow. So you'd have tomorrow and Thursday to review that and give Tim and I some feedback. So Tim, there's an MSBA model. There's some other districts that we've looked at that we have some ideas if we went that direction where we would go. So we could try to get that to you tomorrow for review.
Okay. That feels like 48-hour potentially turnaround time.
Yep, that's up to the board to decide, right? That's why I'm asking for, what would you all like to have? Another option is Monday or sometime next week. But we have staff coming in next week too, so we've been kind of cognizant of that.
And I think the big thing for us, I have to operationalize all of these plans, and the lead times that are provided by these decisions just make it a lot easier, and it makes the communication to the sites, and so they're on the page. I mean, sites are emailing us daily, what do you guys think we're gonna do? And they email me like I have some crystal ball, and I'm like, I'm here with all the crystal balls right now trying to figure this out. So we wanna operationalize it, and that's, the big push, and this is all just, it's a timing issue, it really is.
Well, I do support the board taking a vote regardless, because I do think that is part of our responsibilities. So I guess I'll leave it at that.
Okay, so my last question is, Corey, do you have a sense of how often you'll be meeting with public health?
Every week.
Okay, so I just want to say that I firmly believe that public health is the best place to make these decisions, because they have all the data available. So then we should be able to know fairly quickly if things change, so that we can pivot to another mask recommended or
Yeah,
something.
we weren't meeting weekly during the summer because the rates were really low for
Right.
the summer, but now that we ramped up, we committed to weekly meetings already.
Thank you very much. I support voting on Friday, and I support going with masks.
I really, I know Director Brooks, you talked about being proactive. I think, and I totally hear that. I also think that, man, if you would have asked me earlier this summer, I wouldn't have anticipated this, we'd be in this position. I really wouldn't. Honestly, I really wouldn't. So, and it's really frustrating as we start this year out to be back here. But I also think we need to make a decision for our community so everyone knows, and I think we need to make it in a timely fashion. And I do support the resolution. Obviously you're going to send it us this morning to read through it, but I support that approach, and I do think time is of the essence. So I do support Friday, a special meeting at 7:30.
So what I think I'm hearing, at least I'm hearing 4 of you support Friday meeting and a resolution. If I'm hearing that the majority of the board wants to go that way, I will work with Tim to get one drafted and get out tomorrow as early as we can in the morning. And then I guess you could offer any feedback to Tim and I both on final version of that we could bring to the meeting Friday morning at 7:30. And I'm open to, I think it's important to set the date for that as the first day of school, because we already have guidance for summer. I'm open, if the board, it's really your choice. If you want to say from this date to this date, and we got to revisit it before then, I think that's what you're kind of suggesting, put an end date on it, whether that's, I don't know if you want this conversation every board meeting, but you might. So we could offer up, and Tim and I can come up with in that draft some kind of time frame if you think that helps. It forces the board back together to talk about it at a point in time. We can talk more about when that could be. Maybe it is monthly. I don't know. I got to give that some thought. But we could include that in the draft, and you can give us feedback on, is that too soon, too late, whatever, and then with all that feedback will come with, I'll just bring a new recommendation then to you with that resolution on Friday. That seems
Sounds good.
reasonable.
Okay.
Thank you.
Thank you, everyone. We needed that discussion for sure.
So we're going to transition to we have Christine back a week later. The desire of the board last time was to really, do you want to take a
Yes,
break?
let's take a quick
Okay.
break.
How about, can we come back is 10 minutes too much? Is that okay? Or 5
I think
minutes?
5 is fine.
5, come back at 5 to 8? Okay, thank you. Sorry, Christine, I'll introduce you.
All right. Get you up here, Christine.
made the copies, and I was like.
All right, we're back, everybody, and I want to try this again. So Christine Robluski is from TeamWorks is back, and it really felt like last week at our work session, the board wanted to really keep the momentum going. So I reached out to Christine and said, can you come back next week and follow up with some of the updates that you made decisions on last week, and then some efforts to try to get to those areas we just couldn't get to at the end as well. So I think Christine's going to walk you through the changes that have been made, and then some decisions still left for you on a couple of those strategic directions. But you also have a chance to review the work you did on the mission, vision, core values, those things that we think we heard from the board. So we're excited to have Christine back. She's actually going to help us with this topic and then our next one as well tonight. So with that, Christine, thank you for coming back on short notice.
And they're trying to get back into the document, but I think the board members have access to the Google Docs so that we can make the changes, and they're about to come up for the viewing audience shortly. So I don't think you need me to do the preamble to how we got to this point, since we're picking up from where we left off. Is that okay with all of you?
I was just going to ask, which one are we starting with?
So we're starting with the, it says final copy of ASIO Board Strat Direction Packet A. So, and it's dated for today's date.
Does it have a blue header or a?
We're picking up where we left off last week. Except, this packet actually reflects your discussion at the table last Tuesday afternoon, because it's starting to get into evening. So if we look on page 4, you will see that it has already started to reflect the conversation that you had and my understanding. So I tried to take all of the different feedback, input, ideas that you each had, and sometimes they were consistent, sometimes they weren't exactly consistent, so I tried to take all of that and reflect it here, internalize it, if you will. So on page 4 now, it's the developing strategic roadmap. So the mission statement reflects the changes that you desired. Our mission is to inspire and prepare each and every scholar as often as possible. I tried to change any indication of student to scholar based on the conversation we ended on. With the confidence, courage, and competence to achieve their dreams, contribute to community, engage in a lifetime of learning. So I was looking up there on your dais, and I said, oh, well, that'll be easy to change up there, right? On that line. The vision statement, again, this is what you talked about. You wanted something with more, I'll say, pizzazz, maybe. And it's a pretty straightforward vision statement that builds off of your mission statement. Unleash and enhance the brilliance of our scholars to thrive and change the world. And that's, again, after the discussion you had around the table. The core values, you'll see that they're on page 6. We'll go over that in just a minute. There are new options offered for you based off of what was option B, that kind of format that you liked, but taking all of the conversation you had around the table, and you may find that it's going to be easy to pick from both option A and B and say, we like these, so bring us back a final version that has some hybrid between those two. That's what I anticipate. And then for the strategic directions, we landed on A and D for sure on that language. On B, we had a sense of where you wanted to go with the language, and again, I took my best shot, if you will, at combining all that I heard from you, starting with Jackie's suggestion. So A, B, and D are close to finish. We just want to verify that these are what you would like to have for the strategic directions, and we want to go over the core values, because that was one that was left open. So what I would suggest is that we start with the core values, since actually first I want to confirm, looking at Director Dawson-Walton, that the mission statement and the vision statement reflect what you wanted them to say.
Yes.
Okay. And then move on to the core values to make sure that we can wrap that up. So this is picking up again on the conversation we had last Tuesday. If you go to page 6, you will see a new option A and a new option B. Hopefully you'll see some of what you discussed around the table reflected here in the document. There is some redundancy across A and B, but there's also changes. So what I would suggest, if you want to use the blue dots like we used last time, is you can copy and paste onto the core values, whether it's A or B, the ones that really resonate with you as board members. Again, we tried to reflect what you said you wanted reflected on the district's core values, because that's what you're voting on.
Can we mix and match?
That's what I thought you
Okay.
might want to do. So put it by the actual,
Innovation is exactly
by
the
the
same?
bullets, if you will, yeah.
Font a little bit bigger.
Christine, will you share this document with me again? I have the other one, but not this one.
I'll send it to you.
In my drive.
Michael's going to do that.
Oh.
This is now a district-owned document.
It wasn't an email that came out today from Sherry.
Oh, yeah, Barry.
It's the difference
Yeah.
between the
Yeah, I know, we
apps
had so
version of
many
your
today.
email address and the,
Yeah, I have, because I have so many different,
I can put it to the top of your inbox.
thank you.
Just
Thank you.
Director Books is fast.
I was just going to say that. I was like, because I could see it moving out of the corner of my eye.
Can you send it to me too? I thought I had it. It's the wrong one.
Yeah, I found mine in my Google email. Do we have a limit to the number? Because I'm going to lose track here.
us to do?
Well,
Just like the top 5?
Yeah,
Okay.
like well, actually, you might like, if you liked them all, you could put a blue dot by each of them. I just wanted one dot per value, if you will. But I figured that some would resonate. And remember, our conversation last week was, I like the word, but not the description behind it, so we tried to adjust both. See, some of you are still cutting and pasting. So.
I'm doing the, I like them all, but I know that this is too many.
Well, we can talk about, is there a number you'd prefer? Is everybody ready? Have you had a chance?
I'm good.
Okay. All right, so as we visually look at the results, we can see where there seems to be a strong liking for some of these values. I don't know, Director Dawson Walton, if you wanted to go around the table and have people talk about the values that particularly resonate, and also answer the question that Director Mosqueda-Jones was getting to, which is, are you leaning toward a specific number or grouping of these values? I can see here that the value around integrity, belonging, transparency, innovation, and then individual worth have the most dots, so that might reflect preferences for the board.
I think you mean inclusion,
Inclusion, I'm sorry.
right? Is that
Inclusion, yes.
the one that had 4?
Inclusion and individual worth, yep.
Somebody voted a couple times for integrity, right? Unless you guys, are you voting too? Oh. Oh, no, everybody
board.
did, never mind, okay.
We all did.
Well, I think we see which ones kind of rise to the top, but, we have 50 minutes. I'm seriously asking you. So as you
Move it along,
facilitate this
Christine.
conversation,
Yeah.
I would really defer to you to see how you want to move forward.
All right.
To be efficient with our time, so we can for sure, at least get through this part of it.
Great.
It kind of
So-
looks like you have top 4.
Yeah, we have the top 4, I think.
Well,
I would say top 5.
I was gonna say, I
Top
think there's a
5?
top 5, because if you scroll down, obviously innovation.
Innovation.
Oh, I missed
Down
that.
the
I
bottom.
missed that one. Thank
Yeah,
you for saying
because
that.
I was-
It got
On the
moved
next
from
page.
all of our other
Did.
dots.
So here's my question then. Is it okay then to remove unity and honor from the list? Exploration, you have a couple of dots that have been posted there. That's one that potentially could leave the list. And I'm wondering, for those of you who have selected that as an option, is this the hill you want to die on, so to speak, with exploration?
I would say with exploration, the part that appealed to me was the lifelong learning and keeping that in there as a value, but I am ambivalent on the word exploration.
So we do have that in our mission.
That's what I was gonna say too.
What's that?
We have that in our mission.
Yes.
Okay. So.
Yeah.
All right.
I was really passionate about honor. I you'd put mine there, maybe accidentally put on integrity too, but I just felt like honor is like a higher level word that evokes more inspiration to what we're committed to be than integrity. But, so as far as dying on a sword, that was one that I really, really liked.
All right. Is there, so one of the things that we might be able to do is work in being honorable or honor into something like integrity
Yeah.
or transparency, and we can certainly work to do that. And I'm going to look to Director Simons to say, would that suffice for you?
I mean,
It's the
like I said,
same
it's just
exact
my
wording. It's
Yeah,
just-
it's just the word in front of it is the,
Yeah.
yeah.
They're
that
really
just
similar.
was
I
compelling
really
to me.
struggled with that one as well, like
Me
between
too.
integrity and honor, like, I feel like they're both such high character value traits that we want, so I don't know if it's honor and integrity, and then
Yeah.
with the tagline behind it.
Well, and I've noticed that we use honor in our language in the district, so that's also, maybe that's why it was on there. I think that's actually something we say a lot in the district, that's why it
I
resonated
like
with me
honor
too.
and integrity.
I like, yeah. both
Okay.
of them.
I say
Sorry, I
combine
didn't
them.
mean to talk over you, Tanya.
Okay. Yeah, that'll work.
I like that.
All right, so we have honor and integrity. Now I'm just going to highlight the ones that that there seems to be quite a bit of agreement on. So honor and integrity, belonging had 5 votes. I'm just going to highlight, oh, sorry. Innovation actually had 5 because it's doubled there. And then we move into inclusion, had 4 board members voting there. And transparency as well. Oops. And now we're down to a conversation about individual worth. It looks like Unity had 1 vote. Any particular strong feelings on Unity, or is that okay
Well-
to use belonging in its place?
I was just gonna say, I think one piece that's missing from the highlighted ones, that I think really needs to be included is, and maybe I missed it, but I think the reason I picked individual worth is because it captures more of that, equal intrinsic value piece, which is, I think, really core in our district right now, and a value that I think should stay personally. I think most of us agree that that intrinsic value is important. So I don't know if we could include that in another one, or if maybe we want to consider having 6 core values.
Right, and 6 is well within the range of what I've seen in many board core values.
Is there a way to blend some of the language together? It feels like it could fit with inclusion a bit, too.
I was thinking the same thing.
Like, I like the word language you use about intrinsic value. It feels like we could add it to the,
I mean, I'm fine with 6 too. I mean,
I think we had.
yeah, whatever.
I don't know.
I
how
kind of
you
like the
feel.
words intrinsic value better than individual worth.
Yeah, me too.
I agree with that.
So if we changed individual worth to intrinsic value and then had 6, does everybody agree to that?
I'm good with that, and I didn't choose, because individual worth and exploration were the two that had similar, and I didn't choose between them because.
Great.
The only thing I felt was still missing was something about excellence or owning, like that's the scholar owning their education, and maybe that'll come up more in our strategic, but something about excellence and that everybody.
Isn't
Just
that what's under honor?
interpret.
Well, it doesn't specifically say academics. What if we said highest ethical and academic standards?
Right over here.
It
Or
comes-
highest
comes a little
standards,
bit.
period.
Yeah.
Hmm.
Because ethical, behavioral, social.
Is high standards.
Just high
Yeah.
Yeah,
standards.
I like that.
Okay,
I like that
that
better.
covers it then, I feel.
Does that feel?
That's good.
And Michael was pointing out, so we had, if you look on the table above, we said proposed options. So everyone has equal intrinsic value was something that was recommended as coming forward. So that now is reflected in just new wording in intrinsic value. And then lifelong learning is essential for the individual and community to thrive. That we had reworded somewhat, I think, in the earlier version of options. But that was something that you wanted, that we wanted to bring forward as the leadership team had recommended that that come forward as well. So is that reflected here in the blue highlighted values that you've been agreeing on so far? So intrinsic value, honor and integrity, inclusion, belonging, transparency, and innovation.
Can I throw a thought out there? Because
Yep.
correct me if I'm wrong, Director Simons, but I think that word excellence is something that seems to be part of our culture as a district. And so I'm wondering if we could add 2 more words to the honor integrity, to the highest standards of excellence, to build trust and create the best conditions. Is that getting too wordy? Does that?
Well, then
kinda
where's
hit?
brilliance?
It's in your vision statement.
I know.
The brilliance is in the vision statement.
Did we use the word scholar in that? I was joking.
Yeah.
It's the whole district.
So now I'm looking to Director Simons
Yeah,
on,
I'm just thinking if it got too word salady.
Yeah.
and if
That's
it
what I was
diluted it.
wondering.
But I think let's hold that out and say, like, once we get through the whole document, do we feel like it's adequately reflected, or do we need
yeah.
to?
This is, and this is a draft, but it'll be a complete draft after tonight so that you can agree on it. The other place that may belong is innovation and excellence. Fostering
Oh, that's a
creativity,
good
ideas,
one.
and new ways of thinking and working.
I like that.
Yep,
Yeah.
that's it.
Yeah.
And, you know, the other thing that came up last time, and I don't know if this is the right place, but you know, student-centered. And I don't know if that's part of a core value, that's more of our approach, but just that we are, you know, that is our focus.
Yeah.
Scholars.
If these apply to everybody at every level, then I'm trying to figure out how that applies to scholars as their value, to say student-centered.
I'm just throwing it out
Yeah.
there.
I think you're right that we need to include it somewhere in this in the completed document.
Yep.
But,
And that's like our foundation, for sure.
yeah,
Right.
yeah, I do think that we need to be cognizant of that as we move through this.
Okay.
But I do think that what we put here kind of actually says, if we were to say student-centered, then we'd be like, well, what does that mean? This is what it means.
Yeah.
So I think we've kind of got it.
Okay,
Feels like it's in
Good
the
to know.
mission, too.
Yeah.
it's in the mission.
Well, I was going to say the
It's-
vision is pretty scholar
Yeah,
focused. Just
Okay.
doesn't say scholar center.
All righty.
so I think we have 6 then. Intrinsic value, Honor and integrity, inclusion, belonging, transparency, and then innovation and excellence. That works? Wow.
Despite how often we disagree, we agree on a lot of things.
We do.
Absolutely.
And I don't know if you remember, we talked about that early on in January. So you have more that you agree on than disagree. And I know, given the last that there are differences and you reflect, the differences in the community, but you also can reflect the excellence of resolving conflict and understanding the differences in your personalities and your styles. And I saw it all playing out tonight, by the way, as I was observing you. Yeah, we learned that about their personalities, didn't we?
Put our little things on.
Like green, orange.
Well, let's take a look. So Michael is pointing out, have we landed, or do you feel comfortable with the description behind each of the values? So intrinsic value, does the wording work for you there? Each scholar, staff member, and family is valued and respected for their perspective, experience, and contributions. I'm looking and I'm seeing head, okay. Honor and integrity, holding ourselves, each other, and our system to the highest standards to build trust and create the best conditions for learning. Okay, because we removed ethical from that to be more inclusive, okay.
I have a quick question.
Yeah.
For Michael, you asked the question, and I'm wondering if there's a particular reason why.
Yes, there is. I'm looking at inclusion specifically, and it says including diverse people. So if we use the word including, that would suggest that there's a stratification of value. So I would welcome a conversation potentially around that, how it's currently framed, including diverse people. And if there's, whether it be intentionally engaging or something of that matter, whether it be rather than including, because that would suggest there's a possession.
Right.
Okay.
Could you say again the two words that you said instead of including?
Yeah, so I said intentionally engaging, and I wrote it out just differently, intentionally engaging historically marginalized people, voices, and perspectives as we think about inclusion.
That's
But-
an improvement.
But I
I have
would,
concerns about putting historically marked, because we want to include everybody, not just,
Yeah,
you know what I mean?
that's how I feel.
yeah, I just want to have a conversation about it, so if,
I like
Yes.
intentionally engaging. Or, what do you guys think about respect, something around the word respect, or acceptance, or something, I don't know. I'm not like a wordsmither usually, so.
I really like engaging historically marginalized people because it connects to, the equity piece of our strategic plan.
I do as well. I just wish we could maybe call it out so that it doesn't necessarily narrow the focus to historically marginalized people, that we are capturing the entire district. So maybe we just add in another word that's like, I don't know, particularly or especially or whatever that is, a better word than that. But maybe just, some commas and call it out.
Like intentionally engaging all, including historically marginalized groups.
All
But
does
at least-
include historically marginalized groups.
so maybe we use each and every in the same way that,
Intentionally engaging or seeking.
I mean, we just said everybody has intrinsic value, and I feel like all of our other values were really clear about all and what all means, and now I feel like we're dividing it out again. That's my perspective. And I
Intentionally
think
engaging, can we just say diverse voices and perspectives?
that's where we were to start
That's what
with.
it looked.
Well, I know, but I'm just saying intentionally well, and then
Intentionally
just kind of following,
engaging.
engaging.
Take out people.
Yeah.
Yeah, I think that feels,
intentionally engaging diverse people, voices, and perspectives.
yeah, I don't know if we even need our, right?
That's not
So it
our.
could be
Can we
Engaging
say?
diverse voices.
Voices.
and perspec-
intentionally engaging diverse people, voices, and perspectives.
I would,
Equitably
I don't
and
know if people
respectfully.
resonates with me as much. I don't know. I'm not
Scholars.
a wordsmither either.
Well, it's not just for scholars, because it's like the whole system.
But I know, but intentionally engaging diverse voices and perspectives.
Yeah,
Yeah,
like
no, I
voices
was
and
just-
perspectives.
Oh, sorry.
To the change of
Voices
people
are
to
people.
scholars.
So are we saying
I don't think we
include
need the
people or
word
not?
people.
You can take people out.
Yeah, thank you. I should have just said, yes, I think you can take people out, yeah.
I think historically marginalized groups is something that is definitely in the how we do that, but I think what we're seeking, the end goal is all people. And one way
Yeah.
that we're gonna get there is specifically ensuring that we're engaging all
Do
groups.
we want to say anything about reflective of the population of our district or something like that? If that's the intention, make sure that we're seeking out voices that aren't always, haven't always been at the table.
I think that's
Or
the
one reason.
how, right?
Are we reflecting the diversity of our district?
I mean, I do think that we should call that out in our values because that's an area that we need to focus on, not just as leaders, but, as an entire community. So, and I don't have specific wording or solution for it right now, but I do think it's important that we call out the inclusion that we're looking for.
Something to think about too is again, these are the values. The how is something that you can, that your administrative team will be working on. We can talk more about, as we talk about excellence in governance and management, is using some of the tools like guiding change documents to really frame more specifically how you might want to engage groups. Like there may be times when you actually want a representative sample that really represents your community, and other times where it might be okay to have input and voices, and you're not asking for a random sample representative input on a decision that you're making.
I think this is pretty good
I think it's.
where it is. It's a
yeah,
good
I'm-
definition of
I think
inclusion.
Okay?
I'm comfortable moving forward.
And belonging then, shall we move on? Make sure we have, developing meaningful relationships that build trust, understanding, and community.
I'm thinking you're like moving it up and down, so I'm just like, moving it up and down.
Only on that
Is that-
side.
And I'm looking to see any visual cues from you all. Yes, okay?
Belonging is good.
Belonging, and then transparency, you did talk about that last week. Communicating, behaving, and making decisions clearly and openly. Looking, seeing none of this, okay. Innovation and excellence, that was the one that we added. Excellence, fostering creativity, ideas, and new ways of thinking and working. Does that description fit? Do you want to add anything now that you've added excellence? Seeing some squinting.
Well, this
It doesn't, it talks about innovation, but it doesn't get to the excellence
Yeah.
part of it.
Yeah,
But I'm also not,
we've just
I'd
added.
be fine with the language, so
I-
no additional.
I can't say I love the language. I don't not like it. It just doesn't quite like pop to me as like, yes, this is it, if that makes sense.
All right, yeah, it does.
Okay.
I've been there.
I like it, the working, I'm just like, is there a better
Yeah,
word for working, but I don't know that we have to debate it here. I think
Yeah.
I think it's pretty close, and if anybody has brilliant ideas after this to
Right.
improve upon it, open to it.
Okay, I'm just going to put a note there.
Unless you put being, that gets back to that
I kind of like
ownership.
achieving,
Achieving instead of working.
something instead of
Something
working, but
that's a target, like a high
That's-
aspiration.
yeah, more specific to students, like working, I feel like it applies to adults.
Okay.
Succeeding.
There.
Scholars.
We
Like, what
will-
about like achieving success or something? I don't know. Don't ask me yet.
We're close.
We're close.
Yeah.
And so we will work on working and how we can add excellence there. So with those caveats, does this list work for you all?
Yes.
I have a wrench to throw in the, I'm having troubles with the word engaging. I think sometimes it implies that there are voices that implies that they're not trying to engage and that we're trying to get them to do something that they're not doing. I like seeking better. Am I making any sense whatsoever? It seems like a deficit-based. I'm just thinking in terms of family engagement. We've had discussions in the family engagement field about saying, we got to get families engaged, saying that, they're not doing it when they're doing it in different ways than we've been looking at it, and it's more of our job to go seek those voices out.
So you have.
I'm not opposed to the language, I'm just throwing a little wrench into food for thought, kind of.
I love the change to seeking.
What do you think, Michael?
Engagement.
He's the one that.
I do too.
And either way.
This is my thing. Are we gonna really see, I mean, I just am not, I mean, I don't know. I like engaging, but.
I personally prefer engaging as well.
As I think
Because-
about engaging, I think if it was just engaging, that could be more one way. As I think about intentionally, I think that's more reciprocal in nature. Because even if I say seeking, I can seek, but what am I going to do after I seek? So I think it's more of a dialogue.
A two-way.
A two-way, as we intentionally engaging, that means I'm intentionally finding you and holding space for your perspective. That's how I provide context.
Now, you have this in other parts of the document. You could add to that, to get to your point, Jackie, intentionally engaging and welcoming diverse voices and perspectives, equity and respectfully, because that pushes it to, we're not just doing
That
this
gets
because we
what I'm
have to, we're
saying.
doing this because we want to engage you and we want all to feel welcome.
So what, what
like
is,
that.
what is it? Say it again.
Intentionally engaging and welcoming diverse voices and perspectives equitably and respectfully.
I don't know, I could take it or leave it. I think it's fine the way it is.
I
but-
see Jackie's point that I think intentionally engaging implies action. And that was the part in inclusion that I think needed to be there too. Is actively engaging, which I think is kind of what it says.
Intentionally. I like
Yeah.
All right, so does that settle that description well enough? Okay.
Is everybody okay?
All right, so now we'll move down to the strategic directions, which is now beginning on page 8. So I'm going to confirm A, create safe, welcoming, and inclusive learning environments that foster global curiosity, belonging, innovation, and engagement. So this was the one that you all had agreed on last Tuesday around the table. And I just want to confirm that you're still good with that description.
I'm good with it.
Okay, good. B, there was a lot of discussion around this one. It's long now, I'm just going to point that out. But this does reflect where I think we ended and some of the additional comments that you had made. So build a culture of achievement by providing content-rich, rigorous, and individualized pathways while ensuring that our core practices are inclusive and unique to the needs and expectations of our current and future scholars. I'm going to just add there, what we heard around the table is trying to get away from kind of the negative deficit-based approach and instead say, so really understanding you do want to break down barriers, but what do you do once you break down the barriers? So this is what I heard from you all loud and clear, and this was the way to try and represent that, which is that second part. Ensuring that our core practices are inclusive and unique to the needs and expectations of our current and future scholars.
So I guess like for me, I would end it after pathways and move core practices to the next column because I feel like that's how we do that, but that was just me for how I would read that. There's a strategy and then there's a tactic. And that's practices and instructional practices and procedures, and so that's just how I read it. Is my input.
I actually liked it as is. The only change that I had was I would remove current and future and just do our scholars.
I agree with that.
I'm just going to do.
I do agree with removing current and future scholars as well, and just leaving it as our scholars. Now that, and when I first read it, I was like, oh, I like that. But then when Tanya made that comment just now about how moving it into how we get there, I do see that perspective as well, and I'm wondering what everyone else thinks about that.
So if we do that, then it becomes build a culture of achievement. Because by providing a rich, rigorous, and individualized pathways is also a how. Does that make sense?
Mm-hmm.
So if we're not going to have the how, then it just becomes build a culture of achievement. I personally liked it the way it was. But I can understand that rationale.
Yeah, I don't know, it's not like something I'll fall on a sword for, I think. It can go either way.
I mean, I understand the rationale.
Yeah, I mean, I think if you take current and future scholars, I'm fine with it the way it is. If, I don't know, Director Gray, do you have any, I don't know. what you
Yeah,
think.
I think that's good enough, just to take those words out, making it a little less wordy, but.
I'm not gonna die on a sword, but I just wanna, oh, go ahead, sorry. I'm sorry.
What do you think, Michael? I'm just kidding. I'm putting you on the spot.
You're giving us the look.
Giving us the look.
There's still a lot of room here on the how. I can let you know that.
Yeah.
Yeah. And I'm going to look to your
I'm
superintendent.
thinking you take out current and future
Yep.
and leave the rest,
So,
I do fundamental.
unless you'd like to ending it at pathways.
I really liked current and future.
Make it
No?
your own.
Oh,
I'm just saying. I'm not gonna die on a sword for it, but I really liked current and future. It shows that we're forward thinking.
it does show that, but also like how do, like, never mind. Not even,
Getting
I'm not gonna die on
I
a
was-
sword for it.
I was,
Take it out.
I was
And,
gonna
like,
say something.
let's go.
else.
All right, so
oh, if
now-
you,
No, I was
Okay.
gonna say something that did not make any sense until I said it in my
and
head.
inside that, yeah.
Quick question, so we're kind of working in this blue column. Are we gonna at some point review the next column over, or?
So the work of the board is to decide on the strategic directions. And then the examples in the next 3 columns are all to help you understand the desired improvements that came out through the strategic planning process that led to that
Oh, okay.
strategic direction. So it's really all to help you understand why are we recommending those strategic directions and what might be included, like the likely key performance indicators. You remember I said it's ideas, not necessarily commitments. You'll see them in vision cards in the future.
Okay, got it. Because they just seem to be like a more limited subset of what was in the blue, so that's what I was asking. Okay.
Trying to give you more information rather than less. And I'm sure you're going to see lots more data as we come.
Okay.
Okay, so we have A and B sorted out now.
Well, kind of. I have a question for Michael. I just see you, so my question is, what do you want to say?
I would probably go with potentially build and foster or build and nurture a culture of achievement. And leave it at that, because everything else is a how.
Can you say that one more time?
It would be build and foster or build and nurture a culture of achievement.
And then like nothing else.
Nothing else, because everything else is a how, right? It's content rich, rigorous,
Sonya's point.
Our
what we would do.
core foundational practices. That's the how, and that would show up in the vision cards that we would then report out how we are doing that.
Yeah.
I'm good with it.
But hey, I just
I like, yeah, that really changed it, but I could go that direction too.
I do,
Separating
You can
that
say
out.
no and
I just need like a little bit more in that. So,
I was gonna say I like it, but I feel like it needs like a same thing.
yeah,
Like-
something else, like.
But it's.
I really like the word
Remember.
nurture.
What about,
But so is academic excellence. for
because I
each
think that speaks to our SEL, right? That we have
What?
new curriculum adoption. Our SEL is going to speak to that nurture, and then we're going to have achievement on the curriculum adoption. too. So,
I prefer
Just
nurture.
suggestion.
Or do you
I
want
like
just nurture
nurture.
instead of build?
Build and nurture.
no, I
Build and
think
nurture.
build is important.
We have to build it
Yeah, you
so they
gotta
will
create it first and then
Yeah.
keep nurturing.
Jack, I feel like I'm you tonight, just throwing wrenches all over the place. I'm sorry. I'm just going to stay quiet over here.
I'm sorry, what?
I said, I feel like when you said you're throwing wrenches and things.
Yeah.
I said, I need to stop doing that. I'm just going to be quiet
Also
over here.
add nurture, but leave the rest, like,
Yeah.
other than current and
Yeah.
future, take that out. But,
Yep.
so build and nurture culture, then everything else stays. And it ends with needs and unique to the needs and expectations of our scholars.
What if we say build and nurture a culture of achievement and excellence, period?
Well, we already have excellence before. I guess I'm actually moving backward to kind of the longer version, because I want it to make sure that whenever somebody reads it, they know what it actually means.
Right.
And if it's too short, like
Yeah.
build and nurture a culture of achievement can mean different things to different people, and this is a bit more explicit.
What if instead of by, we say and provide content-rich, rigorous, and
I like by.
I prefer by.
Build and nurture a culture of achievement and provide content-rich, rigorous, and individualized pathways
I like
while
by.
ensuring that core practices are inclusive and unique to the needs and expectations of our scholars.
I like by, but it feels like a mouthful.
well, I like the way by reads and the way it sounds, but when we use that word, it becomes a how versus, and when we say and, it's part of it. Does that make sense?
I don't even think we need the word by. I mean, it could just be providing,
Wait.
Build and nurture a culture of achievement, provide content-rich,
Providing.
rigorous, and individualized
Ooh,
pathways.
you want a semicolon it.
Yeah, that would be adding a lot of
Providing.
grammar.
Like, who wants to semicolon it?
Oh, you did not just semicolon.
Are we close? Would you say that we're close?
We're very
Yeah, we're
close.
very
Okay. I'm sorry. I'm kind of back to what your original point was. Because I can see now, like I'm reading it again, maybe it does end then at pathways. Build and nurture a culture of achievement by providing content-rich, rigorous, and individualized pathways. Like maybe that's kind of back to, I think, the original thing was like, because that would go over to the next.
So there you have a look for it. Look, see. Build and nurture a culture of achievement by providing content-rich, rigorous, and individualized pathways.
I'm good
I
with
kind,
it.
I'm mostly good with it, but I actually kind of like Thomas's suggestion of taking by out.
All right, I think we're probably close enough. Is that all right?
We
Yeah,
are
throw that back at you, Christine.
All right.
Michael.
So it ends at
Tell you what.
pathways now?
Yes.
It ends at pathways. Build and nurture a culture of achievement. I understand that there's the by word here.
Okay.
I'm just going to put color that in case there's an alternative that we can get to, but we're very close.
Great.
All right. All right, so now.
15 minutes left.
Thank you, ma'am. So D, we've already covered. I'm jumping down there, but I'm going to come back up now to this whole category of stakeholder engagement and communication. So you have 3 options there. Now we're back to the beginning conversation around the strategic directions. This is all around stakeholder engagement and communication. And as we were looking at and talking with the cabinet, looking at the materials leading up to this, we really heard themes not just around stakeholder engagement or community engagement, but also that communication piece. Your parents and your students really wanting streamlined communication was one of the examples. Quick communication. You talked about some of that in your first agenda item. We want to give our families time and give that communication. And I can tell you what I heard in your district, that I have heard in other places, is parents with kids in multiple schools saying, is there some way to make it easier on me as a parent? And we heard that with your parents as well.
I feel that.
But that's the parent perspective, right? So you have options here. So the 3 options are, and these are for your strategic directions again, members of the school community are valued, treated with dignity, and used to inform school and district practices. Option B there, if you will, is implement a coherent, integrated communication and decision-making model that includes diverse perspectives as an integral part of our program improvement. Or consistently provide efficient, effective, and transparent communication and inclusively engage with our school community when making key decisions. So those are the 3 kind of takes on this whole category of engagement and communication.
I don't like the middle one.
Okay?
I'm leaning toward the third one because I think we've covered the first one off many ways already in the document. And the second one's kind of, that's sort of a task we're going to do. That's one we're going to do that. So the third one is closest. I don't know if I love it, but it's closest.
Okay.
Yeah, I like the third one as well. That was one I gravitated toward. seems like we're trying to use as many similar words as possible in all of these. And so that's the part I don't like. I wish we could just pick a good word and
All your
use
words are
that.
in one sentence.
Yeah. Yep.
Yeah, I mean, I would say never, oh, sorry, go ahead, Director Brooks, I'm sorry.
No, that's it.
Oh, okay. You know, I also even think like, it's really like we want accurate and timely, you know, also, like, when I think about what we want to get across is something like that to me. I'm not sure I feel, well, I feel like, why am I doing this? But like, even the word inclusively, I'm not sure that's, I'm not feeling that right there. Because we're engaging with our entire school district community, you know? I don't know if we need inclusive, unless,
Could you maybe take out, provide efficient and effective, so consistently and transparently, consistent and transparent communication? Now I'm stuck on the inclusive, take that out too, right, Kelsey?
all right.
The reason I like inclusively is because of the language barrier. With
I would-
communication.
What about the word accessible? Because that would include the language and, you know, also spoken versus
that
written
word.
word.
Yep.
I like accessible.
Do you like consistent and transparent, right?
Yeah, I just have actually like kind of a technical question though. If we're using the word accessible, well, actually, just in regards to our communication, and I know that we always strive to have accessible and inclusive communication and engagement with our communities, but I know that we also miss the mark. And so like, what are the implications of putting those specific words in here and then we do miss the mark? Like,
And then we know how to do better. That's the point. Put them in,
yeah.
right?
But, well, I guess like, what I'm getting at is we have we work really hard when it comes, specifically when we have large communities that need specific forms of communication, like translation, for example. And we really strive to do that, but it's often very difficult to do that when we have like maybe just one or two families that need a specific type of translation and the resources available to provide that. And even though that's always our goal, you know, I don't know how to,
There's a reason we have vision cards. 'Cause
Yeah.
you're always trying to get to vision, and
Okay.
there isn't perfection. There isn't perfection in any district or school, as much as some schools may say they're there. But you're always striving toward that vision, and that's why we call them vision cards, and that's why you see hopefully a progression from, you know, a lower level up to level 5, which is reaching your vision.
yeah.
And so and that's why we always include refinement when we're talking about everything that we do. You're always refining, learning, and adjusting, because the context is always changing too, right? I mean, the conversation you had earlier tonight is one of those, the context changes and you adjust. And that's part of why you have a strategic plan, is because you are adjusting to what the context is, to new learning, new research, everything that's coming at you. So I don't think as much as we'd like to say we're going to reach perfection, this is you as a board directing the organization, giving it focus to say, this is what we're striving for, this is what we're hoping for, and this is what we're trying to measure toward.
What about equitable communication?
So we have, and I will.
Equitable
glad to-
and accessible. Because equitable would imply that efficient, the timeliness.
I'm going to add this word in here, and then we're going to get, so I've heard a few additional words added here. Consistently provide, I've heard transparent, accurate, timely, equitable, and accessible.
I give you a
think-
different version.
Yes, you have one.
Provide consistent, transparent, and accessible communication. Oh, I had it, and that's probably one too many words. Provide consistent, transparent communication and engage with their school community when making key decisions.
I think we can
Is it an
take
and, though, that's what,
accurate out because I personally think accurate falls under transparent.
All right. So someone's typing in purple. Provide, so I heard
does it provide
Lori.
consistent?
timely, no, we have transparent.
If
Provide
it's efficient and
consistent-
effective, it is timely because it's effective. I mean, it'd be a multitude of different things that it is in order to be efficient and effective.
Provide.
Do you like efficient and effective in there, or did you like taking that out?
I mean, I would limit the number of words that we say, use to describe it, is I think more. my
Kind of
point.
like as plain language as possible. Like, I mean, as a parent, I'm like, I want timely information. Like, I want it.
And I will say
Timely and
that
transparent.
Yeah.
what we hear from parents and what we heard from your parents is that consistent, they want consistency in terms of not having things change frequently, consistency and alignment across schools. So I would say things like timely and consistent probably came out more from parents than, while transparent is a great word, a lot of people have different definitions of what transparent means to them, and there may be a lot in that. So I like the word too, but I have seen people have very different meanings behind what they think.
Well, we did just define
transparent.
transparent in our values, though.
Could it be
Yeah,
as
that's
simple
true.
as provide consistent and timely communication and engage with our school committee when making key decisions?
I like that.
The one thing that is missing for me, well, I shouldn't say missing because we don't have to add it, but is easily accessible. Sometimes I feel like we have to hunt for information and log into too many different accounts to get it. Yeah, so that's probably the biggest for me of any of these is it's difficult to find all of the information that they need, especially with multiple schools.
Yeah, and I think we can say what accessible means. So I think, that, I don't know that I'd added into that definition, but
Yeah.
totally agree, like accessible means this, and it can be
Yes.
like in the detail.
More of a
That
Yeah,
is
it can be
intuitive, it's.
Print
it's
or digital,
User-friendly.
spoken word or written word.
More of an action.
Language.
So easily accessible.
Corey, could you say what you said again?
Provide consistent and timely communication and engage our school community when making key decisions.
I like that.
Yeah.
Go, Michael.
Everybody feeling good about that? No?
We got a couple of things going on
You
down
know, we
here.
got that accessibility
Did you want
thing to,
What?
Corey, you said provide consistent and timely communication and engage with our school community when making key decisions. I also heard a couple of the board members wanting accessible or easily accessible in that description.
but then it's provide consistent, timely, and accessible communication and engage with our school community when making key decisions.
Can I ask a question?
Three things in that first part.
And Michael, since you're leading this area, when I've heard you talk about engagement, though, it isn't only when we're making key decisions, it's like throughout the entirety of someone's like duration, whether you're a student or a parent or a grandparent or, community member. So, I don't think engagement's necessarily tied to a key decision.
Agreed.
I think it's like,
So just take that end off, end of that community.
I wonder,
Yeah.
is it through every phase of their scholars' academic career? Because I feel there's something about the flow that at every step of the way, there's engagement over
Every
how
step
that
of the way.
scholar is making it through to get to deliver on the mission. Because I think back to like when we did the interview process and we had engagement, I feel like we've kind of stepped back and sort of narrowed it than when we were actually saying this is what it meant to us when we were interviewing superintendents for it.
Provide
Anybody have any
consistent,
thoughts?
timely, accessible communication and engage with our school community.
I just wrote, I flipped it a little bit and I said inclusively engage our school community and provide timely, consistent, and easily accessible communication.
I don't know, is it too I feel like it's written too tactical versus the other ones.
What do you mean by that?
Like, I feel like the other strategic directions are kind of have like a higher order kind of language to them, and then you say we'll do these tactics to achieve that, where I feel like this, like, timely, accessible, are a little tactical, because I'm comparing it back to when we did that engagement and the ideas that we heard from family engagement when we were doing the interview process. I don't know how to fix it, but I feel like there's a gap.
I like down here at the bottom, I don't know who wrote this.
In red?
Yeah, provide accurate, relevant, accessible information that is timely and consistent. I particularly like the word relevant
So if we, I guess, the way that I'd ask the question be, if we did that, the way it's written, would we be able to go around the state and be like, we are like incredible at stakeholder engagement and communication because we do this? Like, I feel like it'd be like, oh, that's kind of what you're supposed to do all the time. I don't know, that's just like, that's how I'm
That's a good
interpreting,
point.
that's how I'm testing it in my brain.
So the item, Heather, that you were just mentioning, the one thing that doesn't include, unless it is the whole notion of how, if you're engaging your community. So there's both communication and engagement that we heard from your community about really wanting both to be valued as part of having their voices heard, as decisions are made about their scholars or at the district level or at the school level, but also from that parental perspective in particular, and from your students and staff, having that communication. When are things going to happen, that I know what's coming, and so I have that timely and accurate communication. So I think that's one of the things that Michael and I were talking about. It's a both and.
I think the piece to me that really stood out is the specific word relevant, that I think should be included, because I also think that we get so much information, and a lot of it is not relevant to our student, and so then the relevant stuff gets dismissed, because people are like, I've gotten 50 emails from the school this week, and they ignore it. So that's kind of what I was thinking about when I saw that word, is that we kind of take a more targeted approach at certain types of communication, like when the ACTs are, things like that, you know?
You could take out consistent, provide timely, relevant, and accessible communication, and actively engage with our school community.
Actively engage with our school, what's missing for me is like, that is ongoing, or that is, I think that's what we really want to change, right? Like, that's what we keep talking about. Like, it's not just when big issues like masks, or, things come up. It's like, we want to continue that throughout, whether it's curriculum, or whether it's school start time, whatever it is, like, throughout.
She might have got it.
Well, that speaks to me like partnership. Like we've said, engagement means that we're all partners in this together, and that your voice matters for your scholar.
Provide timely, relevant, and accessible communication, and actively partner with our school
That's
community
word
at each
salad.
step of our scholars' journeys.
That's word salad again. I just like, I keep thinking again, what if we were up presenting like at the school board association as the leader in
NSBA.
That's what you dream about?
as the leader.
Like,
This is what I do, right? what would that look like? Or because I just still feel like this is a little bit like very like, yeah, of course. Like,
do you
have to do that.
conflate communication and engagement?
Yeah, they're a little bit conflated.
Or do we want to can we have two separate sentences with
We
them?
can have two separate sentences, absolutely. The direction, though, is, what is the direction? So as you are working through the organization, and they are seeking your direction and focus as a board, we could certainly have two sentences. We generally don't when we have a strategic direction, which is probably why B ended up being a little bit long. But they are separate.
Communication to me is one way.
Yeah.
Like, we're giving information to people, like, that's relevant, that's accurate, that's timely. This is the decision. When I've heard Michael talk about engagement in your team, it's really that two-way, like, we're hearing back. So I think it would warrant maybe two, if we had one sentence each, or some way to kind of, because I do think they have distinct roles, which is why we have a whole, new area focused on it.
So they both need to be included in here, right? And communication is a form of engagement, but I agree with you, we're thinking International Association
Yeah, I
of Public
do too,
Participation,
yeah.
right? It's on the lowest level of engagement,
It's like
because we're
informing.
promising to communicate to you, with you. And so having both of those reflected in here, I'm hearing from you that this isn't quite there, and you want to have both of them reflected in here.
Yeah, I'm thinking like, what if we start with our commitment to engagement, and then say, and this is how we'll communicate, or something, so that it's clear that it's two things, but in the same box, but putting that engagement piece first.
Yeah, that's what I'm saying.
So I would offer engagement, yes, it's important, and in 2019, the board recommended that we put that so it's present in each of the school's site improvement plans. We have family and community engagement there. So being that that has a presence in our operations at the site level, would this be a time that we potentially focus more on communication than that of engagement, being that there already is an expectation there, and there's a rubric that's in development that will be showing tomorrow night at the RISE committee meeting. So just a thought. I
Yeah.
don't know how you all feel about that.
So I actually based on what you said, then I actually think family and community engagement should be in the first column, because that's what we said our priority was, and every site has a plan. Communication is one way that we deliver on that. Because if it's in every site plan, like that, that is a strategic direction.
So we're still at engagement and communications both. Yeah. Okay.
Well, let me ask, I'm
Yeah.
sorry, I'm just saying yes. Do you have Director of Books?
Ooh, I mean, I think that we need to incorporate them both. I do understand that it's in the site plans, but like, to me, this is one of the first sort of excerpts that anyone would look at to determine what our strategic direction would be. And I don't think they should have to dig to find out more about engagement in a separate place. So that's, yeah.
Dr. Douglas?
I agree.
Okay. Gabe Jones? Do you have a-
I think we should, I'm just gonna agree with.
Director Simon? Yeah.
That's fine.
Director Grady?
Yeah, I think engagement and communication have to go together.
Yeah.
Even though one's top-down and the other one's bottom-up, but they're all part of the
Go
same
hand in
thing.
hand.
All right. So I have a sense here
Okay.
that where you want to go. I've added a new, it's in black at the top, engage with our community and communicate in ways that are easily accessible, timely, and relevant.
I like the words inclusively and actively. Engage or partner with our community.
So we're at a little after 9.
Okay?
Do you want to, how do you want to proceed? Do you, we have one more, well, we're not
Item.
finished with this, and then we have,
So I have a better sense now
Okay.
of the two things that you need included. We're not there yet,
Yep.
so we'll need
You'll
to
go-
come back to you
great.
on this one.
Okay.
But we know that the two elements that you want included there. Shall we move on to E?
Yeah, if you can give some sense on E, because then we can
work on it?
potentially get that, now we're through that. this
So
whole
let's just
thing.
give it to the latest 9:15, and then we'll.
Got it.
So I think D's, I don't
D is
think we have
set.
much issue with
You've
D.
all agreed on D last time.
Okay.
And then this is really around this is the strategic direction that focuses on everything from professional development, that support system for professional development, and holding yourself accountable. So you do everything at the front end to provide in your system the program improvement, the professional development, and then at the back end saying, and we're also going to hold ourselves accountable for the results. So you have two options there: align our program supports and people to be a true continuous improvement system that reflects, reviews, and adjusts. There's that core practices word again. Based on evidence and accountability, or leadership for rapid improvement, continuous self-study while implementing evidence-based practices toward instructional transformation.
I like the word, the leadership for rapid improvement, that language specifically, because it has that urgency of getting to where we want to be. But I don't particularly love either of these statements as they are.
All right? Feedback from others?
I like that first one better than the second because it sounds more everyday language versus technical.
I like the first one better. I feel like there's too many words in it, though.
Yep.
And I don't know if maybe true continuous improvement comes out, but I don't really want to lose continuous improvement because it's a key part of what we do. I think there's just a lot in there, but I like the top one better,
Okay.
especially the align part.
I love the leadership for rapid improvement. I like that. And then it's almost like, could we kind of finesse the first one to,
Let me
Like-
take a crack at it. Leadership for rapid improvement that aligns our programs our program supports and people to be a true continuous improvement system based on evidence and accountability.
Why do we need the word true?
Yeah, I don't
true
like
is
that.
ridiculous. Yeah, it doesn't make sense.
What if it was leadership for rapid improvement, align our program supports and people or process towards or to in continuous improvement system?
can I ask why we use people? I just don't know. I
I was actually wondering if there was like one word we could use instead of program supports and people.
Well, you could use, we would have systems.
Yeah,
and then-
system. I don't like that word, though, in this place.
Yeah, it doesn't feel
Leadership for
right.
No,
rapid,
it doesn't. But it would include that.
Yeah,
that aligns our system toward continuous improvement.
We'd have to find a different word for system, I think.
Yeah, because again, that means different things to different people.
Yeah.
Just district, why not?
yeah, and I think we can't lose accountability.
I agree with that.
Leadership for rapid improvement that aligns all aspects of our district toward continuous improvement and accountability.
I like that.
yep, I'm good.
Yeah, I like that.
Good.
Oh, wow.
Tag. And Christine's like, what just happened there?
Okay. That's for real?
I'm gonna throw a wrench. No, the other stuff, all of the other pieces are how we get there. So it's not that it just disappears.
Sure.
Yeah.
Yes.
How we get there.
Okay.
Yeah.
So we have 4 out of 5.
Yeah, so-
C, we will work on communication and engagement together. So otherwise, I think we have enough from which to work, and I will get
Keep
it back to you.
reworking the calendar, yeah.
That's right.
What we do.
All right.
Okay. Now, you want to move on to the final piece of the agenda, or not?
No.
Okay.
No, we'll reschedule.
We will reschedule.
But, you know, in us, take a look at this
Yeah.
though, because we reformatted, we put the 3 pieces into one, right? So we tried to capture agenda setting, and then we put next the resolution flow chart and process, and then also, then finished up with the board commitments. So this is really, in theory, this isn't policy or procedure, it's more of your practices with one another around how you're agreeing to work. So, no, the board could, if you chose, take these things to a policy or procedure level, but right as we started, we were trying to just get, what's our practice around these topics?
Were we gonna approve this, or is it just like you described, more of a supplemental document that we use?
Yeah, it's more of that.
Okay, got it.
It's more of a supplemental thing. I don't think you need to
Okay.
act on it or vote on it. It's more of your commitments to each other that we'll review at least twice a year. So we would review, you know,
Well, I think we've spent, so since January, really in our professional development sessions we want to be a high-functioning board, and kind of get in the cycle of like respect and trust, and that, I think we've really come a long way in candor, and so I do think it's important to visit this as just kind of our like you said, our commitment
yep.
to each other as a board. And I think
And-
it fits really well with our strategic direction that we're going. So.
And it reflects all of the development conversations
Yeah.
we've had over time, and some of the work you've all done in sort of committee level work as well. And so we've tried to pull all that together.
Sure.
Do you want us, instead of just saying we're gonna wait, do you want us to provide feedback, like, to you, and then that way the next time if we do talk about it in a work session, we're more efficient, or you determine if we need to talk about it based on our feedback?
Yeah, last time, after each section of these things, we didn't get a lot of feedback right after, but I'm not sure if that's where your heads were, honestly. So it's another opportunity to, maybe take the next week.
Okay.
Maybe I'll include it in my update this week too, just to check back on this and give me an update by a date. Do you like having deadlines?
Yes.
Yeah,
Like, do a big list.
and I can prompt the superintendent to prompt you all.
Yeah.
Yep,
Think
that'd
through
be
how to,
great.
how to get
Yes.
your feedback on this.
Yeah.
In a timely manner, and effective and efficient, and accurate and accessible.
Transparent. All right, well, thank you, Christine and Michael and everyone. This work session is adjourned at 9:10 PM.